members, invited stakeholders. Let me also announce that we have just received a message that the chairman of Nigerian Governors Forum, Kayode Fayemi, the chairman of Northern Governors Forum, Simon Lalong, and of course, the governor of Kebbi State, Abubakar Atiku Bagudu, are on their way coming. Thank you. The President of Nigerian Labour Congress, Comrade Ayuba Waba. You're welcome, sir. Ladies and gentlemen, I announce the arrival of the chairman of Northern Governors Forum, who of course is also the governor of Plateau State, Governor Simon Lalong. You're welcome, sir. It's from them. Again, I want to apologize to stakeholders here present. If you are here with 2 or 3 of your staff, we can only accommodate the chief executive into this hall because we need to observe the social distance. Please bear with us. Ladies and gentlemen, permit me to also welcome into this hall the chairman of Nigerian Governors Forum, and of course, the governor of Ekiti State, Governor Kayode Fayemi. You're welcome, sir.
YouTube live stream, just in case anybody.
Please, those by the door, if you are here with your governor, please, we are sorry, we apologize. We cannot allow you into this hall. As I said earlier, we need to observe the social distance, and we are expecting so many guests, so many stakeholders are coming. Please.
On the 10th to the 11th of June 2020, the Joint House Committees on Healthcare Services, Health Institutions and Justice will conduct a two-day public hearing, a bill for an act to repeal the Quarantine Act and enact the Control of Infectious Disease Act. The committee hereby invites memoranda from the public and particularly from key stakeholders in the health sector, security, justice, international development, civil society, media, transport, traditional and religious institutions. Members of the public and stakeholders should submit one soft copy in a flash drive and 50 hard copies of each typed memorandum, which should be addressed to the Deputy Director, Clerk Committee on Healthcare Services in H102, White House, House of Representatives Wing, National Assembly Complex, Abuja, Monday, the 1st of June 2020. Receipt of the memoranda will end on Friday, 5th of June 2020. Please note that the public hearing will be conducted in line with the COVID-19 Nigerian Center for Disease Control NCDC guidelines, with strict adherence to wearing a face mask and observance of social distancing. The general public is also advised to follow the public hearing on the following social media accounts: YouTube Live, Facebook, and Twitter. For further details, contact the Deputy Director, Committee Clerk, Mrs. Joyce Aniete Umorum, on 080-659-23157 or email healthcareservices.nas@gmail.com. This message is from the Joint House Committee on Healthcare Services, Health Institutions and Justice, Federal House of Representatives, Nigeria. On the 10th to the 11th of June 2020, the Joint House Committees on Healthcare Services, Health Institutions and Justice will conduct a two-day public hearing, a bill for an act to repeal the Quarantine Act and enact the Control of Infectious Disease Act. The committee hereby invites memoranda from the public and particularly from key stakeholders in the health sector, security, justice, international development, civil society, media, transport, traditional and religious institutions. Members of the public and stakeholders should submit one soft copy in a flash drive and 50 hard copies of each typed memorandum, which should be addressed to the Deputy Director, Clerk Committee on Healthcare Services in H102, White House, House of Representatives Wing, National Assembly Complex, Abuja, Monday, the 1st of June 2020. Receipt of the memoranda will end on Friday, 5th of June 2020. Please note that the public hearing will be conducted in line with the COVID-19 Nigerian Center for Disease Control NCDC guidelines, with strict adherence to wearing a face mask and observance of social distancing. The general public is also advised to follow the public hearing on the following social media accounts: YouTube Live, Facebook, and Twitter. For further details, contact the Deputy Director, Committee Clerk, Mrs. Joyce Aniete Umorum, on 080-659-23157 or email healthcareservices.nas@gmail.com. This message is from the Joint House Committee on Healthcare Services, Health Institutions and Justice, Federal House of Representatives, Nigeria. On the 10th to the 11th of June 2020, the Joint House Committees on Healthcare Services, Health Institutions and Justice will conduct a two-day public hearing, a bill for an act to repeal the Quarantine Act and enact the Control of Infectious Disease Act. The committee hereby invites memoranda from the public and particularly from key stakeholders in the health sector, security, justice, international development, civil society, media, transport, traditional and religious institutions. Members of the public and stakeholders should submit one soft copy in a flash drive and 50 hard copies of each typed memorandum, which should be addressed to the Deputy Director, Clerk Committee on Healthcare Services in H102, White House, House of Representatives Wing, National Assembly Complex, Abuja, Monday, the 1st of June 2020. Receipt of the memoranda will end on Friday, 5th of June 2020. Please note that the public hearing will be conducted in line with the COVID-19 Nigerian Center for Disease Control NCDC guidelines, with strict adherence to wearing a face mask and observance of social distancing. The general public is also advised to follow the public hearing on the following social media accounts: YouTube Live, Facebook, and Twitter. For further details, contact the Deputy Director, Committee Clerk, Mrs. Joyce Aniete Umorum, on 080-659-23157 or email healthcareservices.nas@gmail.com. This message is from the Joint House Committee on Healthcare Services, Health Institutions and Justice, Federal House of Representatives, Nigeria. On the 10th to the 11th of House Committees on Healthcare Services, Health Institutions and Justice will conduct a two-day public hearing, a bill for an act to repeal the Quarantine Act services.nas@gmail.com. This message is from the Joint House Committee on Healthcare Services, Health Institutions, and Justice, Federal House of Representatives, Nigeria. On the 10th to the 11th of June 2020, the Joint House Committees on Healthcare Services on the following social media accounts: YouTube Live, Facebook, and Twitter. For further details, contact the Deputy Director, Committee Clerk, Mrs. Joyce Aniete Umorum, on 080-659-23157 or email healthcareservices.nas@gmail.com. This message is from the Joint House Committee on Healthcare Services, Health Institutions, and Justice.
May we please remain standing? Let's remain standing as we sing the national anthem. You're welcome, sir. It is my honor to invite for a remark the Chairman, Senate Committee on Primary Health and Communicable Diseases, distinguished Senator Chukwuka Utazi. You're welcome, sir.
The representative of the Speaker of the Federal House of Representatives, the man variously described as a strong man at home and at home, Right Honorable Dokua, the Chununo, and your other co-chairmen that invited us here today. I recognize my colleague, in the colleague in the Senate and the chairman of...
Yes, that's a question.
of trying to have a legal framework to guide the activities of government in everything we do. We know that health is on the concurrent legislative list. The state governments have their right to do their thing. The federal government have the right to do their thing. And the local government area are going to follow from the state governors. What we are trying to do here is to set the pace, to set the agenda, have a nation, have an act that will guide the activities of the governors on their houses of assembly in having a deal to manage this issue, so that there will be uniformity in handling this issue, so that we will not be handling this issue in a staccato approach as we are doing presently. We know the Quarantine Act is that of the federal. The state governments cannot legislate in that area. That one is exclusive to us here. We are handling that, and the shortcomings we have noticed in the 1926 Quarantine Act. We are trying to correct them and bring them to speed to solve the problems here. So on behalf of my colleagues in the National Assembly, we are totally behind this good effort by the House of Representatives in taking the lead. Very shortly, the Senate of the Federal Republic will be convoking this kind of a forum too, where we are going to find solution to this. This shows what Sonunu and his colleagues are doing here today is to show that we are representatives of the people. We don't take laws into our hands. We want informed opinion from the society to make input into what we are doing, so that at the end of the day, we are going to have a legislation that have the national appeal, have a legislation that will satisfy the hidden aspirations of Nigerians and solve a problem of this nature that is before us here. So that since this sickness is coming almost like 100 years after the other, the last one we had was in 1918 to 1920. So we don't know when another century will come, and we have an issue of this nature. We are here trying to think for 400 years to come by this legislation we are doing here today. And I'm totally in support of this movement, and I want the public that are invited here to make their contribution to this effort. We want people to make their informed decision to get things done. People who are there criticizing that it shouldn't be done in the first place, they don't understand what we do here. The essence of legislators and the legislature in the country. We have to do something, have to find solution. If you are opposed to it, bring a better opinion. At the end of the day, we arrive at a consensus and do something that will be better for all of us. Thank you so much for having me here.
Thank you so much, distinguished Senator. Quickly, may I also invite, I want to be very fast because the chairman has warned me. I don't want him to throw me out of this hall. May I quickly invite for also a remark the chairman, Senate Committee on Health, distinguished Senator Yahya Ibrahim Oloriegbe.
Thank you very much. In view of time, let me just say good morning, distinguished ladies and gentlemen. and I stand on all existing protocol. But I particularly want to thank our colleagues and brothers, the governors of Ekiti and Plateau, as well as all civil society organizations that are here, because without citizens' participation and contribution, we cannot talk of democracy, and democracy is in action here today. The law has been proposed by an arm of the National Assembly, which is the people's representatives. And you can see the representative of the people also here. So it's the government of the people, by the people that we are demonstrating. Suffice to say that what we are sitting here for today, we need to answer 3 questions. One, is there a need for the law? And I think my own candid opinion, yes. Because the Quarantine Act of 1926 is definitely outdated. And what was happening then is not what we have now. So definitely there's a need. And the need was also shown by the experiences we're having with the COVID-19 pandemic. We've had challenges, even despite the fact that there has been a lot of management. You can see there has been inter-government conflict between federal state. You can see some states not going in line with a national directive, whereas we have a national emergency. We can see some individuals challenging the authority of institutions that are there to protect life of citizens. Where an individual said, you don't have power to keep me in an isolation center, I need to get a WHO or to get a UN to come and test me, because, and the person is at risk. So this shows that we definitely need a law. What kind of law do we need? And that's the other question. So definitely the law that we'll make will be within the confine of our constitution, which will be able to safeguard not only the rights of citizens, but the right, in terms of what their right is. But as they often said, where your right ends, the others begin. The overall right is the protection of life of the citizens or anybody that is resident within the confine of Nigeria. So that law, or whatever law that will come out, must suit to that. The other thing is that the law within the constitution must recognize that we're a federation, where there are powers and responsibilities allocated to different agencies. The other thing that the law will have to look at is the various structures that we have in the health sector, the role of the various agencies and how they interrelate and how they will cooperate together to deliver good service. In which case, such a law will look at the effectiveness and efficiency and appropriate interrelationship and coordination of the system. So, and finally, of course, it must be a law that's acceptable to all Nigerians. And that's why the Constitution set out the lawmaking process, which part of it is. So therefore, it is our expectation that at the end of the hearing today, the process of the lawmaking that will satisfy all what I've said will have been achieved. I thank my colleagues in the House of Rep for inviting us to witness this. And as my co-chair from the Senate, my colleagues, distinguished representatives, said, definitely the Senate will also have a similar process to be able to enrich the law. Thank you very much. I wish you all successful administration.
Thank you so much, distinguished Senator. Mr. Chairman, before I invite the next thing on the agenda, permit me to quickly inform our guests that this public hearing is live on the largest television in Africa, the NTA, and the multiple award-winning television, the channels, and of course, it's being streamed live on NAS TV. You can view it on Facebook, just type NAS TV, on YouTube, typed House of Representatives, and on Twitter, typed House NGR, NGR in capital letter. You can also view it courtesy of the National Assembly ICT on YouTube by typing Healthcare Services of House of Reps, Nigeria. Healthcare Services, House of Reps, Nigeria. Mr. Chairman, distinguished senators, Your Excellencies, the governors here present, members of this ad hoc, members of this joint committee, honorable members here present, invited stakeholders, members of the pen profession. It is my honor and privilege to invite to the podium the Speaker of the House of Representatives, Representative Femi Gbajabiamila, ably represented here by a man who is strong both in the office and at home, the leader of the House of Representatives, Right Honorable Al-Hassan Adodogwa, to please present his keynote address and declare this hearing open. Your Excellency.
Thank you. I thank God, even when I was laughing, I believe nobody noticed because I'm wearing the face mask. Whether laughing or... أعوذ بالله من الشيطان الرجيم بسم الله الرحمن الرحيم وصلى الله على النبي الكريم. The chairman of the House Standing Committee on Health Services and Institutions, respectively, the chairman of the relevant committees from our sister chamber, the Senate of the Federal Republic of Nigeria, institutions and services, respectively, that are here present with us, my distinguished colleagues, honorable members of the House of Representatives, who are equally members of this standing committee, I would have begged to stand on existing protocol, but I'm afraid with the presence of the shakers and movers of Nigerian politics, I can't skip to overlook the acknowledgement and recognition of the presence of the chairman of the Nigeria's Governors Forum and the chairman of my governors, the APC Governors, the chairman of the Northern Governors Forum. I'm sure you are in double today, the chairman of the Northern Governors Forum or the other governor too. You must have to be representing the chairman of the Progressive Governors Forum as well. So I recognize the presence in absentia, the chairman of the Progressive Governors Forum, who is also my governor, the governor of the Kebbi State. I believe one of you must be representing him here in spirit. Other invited guests, most especially the DG NCDC, the DG NAPDAC, President of the Nigerian Labour Congress, in person or being represented, and the representative of the Inspector General of Police. Distinguished ladies and gentlemen, like I said, I beg to stand on the already laid down protocols. Let me say a very good morning or afternoon, as the case may be. I stand here on behalf of the Speaker of the House of Representatives, Right Honorable Femi Gbajabiamila, to deliver a speech to mark the opening of this important public hearing being conducted by joint committees of health institutions, health services, and the Committee on Justice of the Federal House of Representatives, the House of the Peoples of the Federal Republic of Nigeria. I would like to say before I begin my presentation of the speech of the Speaker, for the records, that whatever I may present that is in context and in the perspective of the Speaker of the House of Representatives, my dear brothers, the press, you give credit to the Speaker. This is a very sensitive, controversial, and widely discussed matter. If for any reason, human or otherwise, that I mispresent the Speaker here, please, I take the blame and the responsibility proudly. Distinguished ladies and gentlemen, while I stand once again on the protocols established, let me begin the speech. Good morning, ladies and gentlemen, and I welcome you to the opening of this public hearing, and I thank you all for taking time to be here with us today. In the last 1 month or so, since the Control of Infectious Disease Bill was first brought forward for consideration by the House of Representatives, we have witnessed an unprecedented amount of engagement by a cross-section of the Nigerian public. This is, of course, a good thing for the process, for this legislative process. What we have here is a critical piece of legislation that deals with matters of public health that affect all of us, directly or indirectly. If we have learned one thing from the last few months, it is that public health issues can drastically change our lives in ways we cannot always predict, and therefore must be prepared for it. The House of Representatives is grateful for, and we welcome the enthusiastic participation of our fellow citizens in this legislative process. We look forward to producing final legislation that reflects our own best intentions, as well as the considered contributions of all people of good conscience. However, it is necessary to note at this point in time that a lot of this engagement on this proposed legislation has been ill-informed and outrightly malicious. There are those in our society who benefit from promoting the falsehood, and every government action There are those in our society who benefit from promoting the falsehood that every action from the government is cynical and every policy proposal must be the product of malignant influence. We must not succumb to the impulses of these elements of our society, and we must reject them always, as doing so is an excellent service to a nation we love and we all hold on to. This public hearing, the conversations that we'll hold here today and tomorrow, the numerous written contributions we have received and will consider as we work towards improving this bill are a bold statement of our resolve to continue to act in the finest democratic traditions as a legislative institution. The control of infectious disease bill is but a legislative proposal. It is a bit that is it could be an imperfect document, as is the nature of such proposals, and we will be improving substantially through interactions with stakeholders, civil society, and citizens in pursuit of the common objective of achieving policy interventions that will enhance the well-being of the generality of the people of the Federal Republic of Nigeria. I ask all of you who have taken the time to be here today to participate in these hearings with an open mind. I assure you, therefore, three things will be respected in the conduct of this public hearing and subsequently in our legislative consideration of this very important legislation. The first is that no part of this bill is in any way the product of any external influence. The second is that we will not ignore your contributions and recommendations, as the House of Representatives is wholly committed to refining this bill until we have a document that resolves our present health problems without creating new ones or provoking unforeseen challenges. And finally, I assure you that now and always our first commitment is to the Nigerian people, our fellow citizens, on whose behalf we hold office and in whose names we are acting. Finally, I want to thank you once again for taking time to be here with us today. I welcome you to the House of Representatives, and I, on behalf of the Speaker of the House, Right Honorable Femi Bajabiamila, hereby declare this public hearing open and committing it to the glory of God. God bless you all, and God bless the Federal Republic of Nigeria. Thank you. I think on the usual note, at this point in time, I should have to depart for other engagements. But let me seek the leverage of my distinguished colleagues, the chairman of the two relevant committees handling this public hearing, and the gentlemen that are, ladies and gentlemen that are invited. For two reasons, I would like to stay behind and be part of the beginning of this process. One, like I said earlier on, I have seen the representation of the shakers and movers of Nigerian politics. I would want to personally stay behind to hear their own take on this all-important bill under consideration. I'm sure they are governors of the Nigerian people of their respective states, and I believe there will be governors who would want to identify with the popular policies and positions of the National Assembly as an institution, so that together we operate on the same page and deliver the expected goods, especially in the public sector, for the benefit of our people. And the second reason might be on a lighter note. I won't know whether I can be Speaker in the House of Representatives in the future. So now that I have the opportunity to represent Mr. Speaker here, I would like to stay behind and enjoy the leverage of being addressed as the Speaker of the House of Representatives. But I hate the way the Senate Chairman on Health Committee, I didn't like the way he introduced me. When you just said the Speaker here, if you like just say being represented, you don't have to continue to say, oh, by the leader of the House of Representatives, because I cannot, of course, occupy two positions at the same time. So I will crave the indulgences of any presenter that when he comes to recognize me here, just recognize that the Speaker of the House of Representatives is here. At least for the purpose of this event. Thank you, and God bless the Federal Republic of Nigeria. Thank you.
Thank you, Mr. Speaker. Thank you, Mr. Speaker. It's not just for the purpose of this public hearing. By the grace of God, one day you'll be Speaker of the House of Representatives. Your Excellencies, Mr. Chairman, distinguished senators, honorable members, invited stakeholders, if you have the program before you, we will have to alter it. The Speaker is here, still want to remain here to listen to the governors that are here. Before we take the vote of thanks, which will allow the Speaker to go back to plenary, let me quickly invite the man who was described by Senator Ustazi as an intellectual in service, the chairman of Nigeria's Governors Forum and governor of Ekiti State, Kayode Fayemi, to please come to the podium and present the view of the Nigerian governors on this bill.
Thank you. Thank you, moderator. Let me start by thanking the chairman of the House Committee on Health, Honorable Yusuf Tanko Sununu, for the invitation to this public hearing. Your Excellency, the Speaker of the Federal House of Representatives, here represented by my own brother and longtime friend, the leader of leaders, Right Honorable Adodogwa, the distinguished chairman of the Senate Committee on Primary Health, Senator Utazi, and the Senate Committee on Health, Senator Dr. Yaya Oloriegbe, the chairman of the Senate, the Deputy Chairman of Senate Committee on Healthcare Services, my brother, Honorable Dr. Senator Dr. Samuel Adejare, other members of the House Committee on Health Care Services and Health, my brother, the chairman of the Northern Governors Forum, who is here in his capacity as a distinguished member of the Nigerian Governors Forum, and not as a representative of the All Progressive Congress. In the Nigerian Governors Forum, we have governors from both sides of the divide. Right Honorable Speaker, so we are here on behalf of the Nigerian governors, the 36 of them. All the distinguished leaders who are present here, participants, I've seen the DG of NAFDAC, I've seen my president of the Labour Congress, I've seen the DG of NCDC, I've seen many people, which speaks to the importance of what we're doing here today. Our own Director General is also here at the Nigerian Governors Forum. And I'm delighted that we are given the opportunity to speak to this, having gotten into some rough weathers with the House of Representatives over our concerns as expressed on this particular bill. But I want to commend the Right Honourable Speaker for dousing that tension and getting across to me. And we spoke as brothers to say we are all in this together, and our interest is to ensure that we prepare in a manner that these public health challenges, which will not stop. We pray that COVID comes to an end and a vaccine is discovered very soon to tackle it. But we know, as professionals tell us, that another public health emergency will come up in the future. And what we're all dealing with here is to have a framework that would enable us address the challenges that may not have been covered in the Quarantine Act and that may also not have been fully addressed in the NCDC Act, but which would help us to deal with this pandemic in the event of another one coming up. And for us at the Nigerian Governors Forum, our position is that any disease with significant threat to public health that will require authorizing measures that may potentially infringe or otherwise reserve human liberties, the proposed measures must take into account a number of ethical considerations balancing public health against human rights. These considerations include public health necessity. The measures must be exercised on the basis of a confirmed or suspected threat to public health. It must be by reasonable and effective means. The means clearly that all must see as being effective in preventing or reducing spread. It must be the least restrictive intervention. It must aid distributive justice. It must promote trust and transparency and ensure that the procedural rights are clear to all. And in the event of the need for compensation, it must also provide for fair compensation. And any intervention seeking to provide a comprehensive legal and policy framework to ensure the effective management of cases involving infectious diseases, streamlining of public health responses and preparedness, involvement and coordination of all tiers of government, and transparency in the management of infectious diseases is a positive development that must be commended. And the effort of the House Committee and the entire House of Representatives is one that we commend wholeheartedly. I'm glad, however, that a number of caveats have come up by previous speakers, particularly Senator Utazi highlighted what may be limitations, and even Right Honorable Adodogua also highlighted that this is really not the end of the road. It is the beginning, and we must consider this document an imperfect document. So whatever I say is not an indictment or a criticism from the Nigerian Governors Forum. It is a reflection of what we see, even as we deal with this pandemic, that it is largely local. And we have to have a response mechanism that is also local in its universality. Because in dealing with it, it's a universal challenge, but there are local circumstances and local issues that would enable each state deal with it, each local government deal with it, and even the federal government deal with it differently. And so for us, there is no question that the Quarantine Act is inadequate. It's a 1926 law. So let's not even go into that debate. The question is, how do we make that, how do we organize an improvement that would then respond to the challenges of the moment? And in responding to that, let me say, governors in Nigeria over the last few months, from round about March to now, have worked very closely with the NCDC. And we can attest to the capacity, the commitment, and professionalism of the leadership of NCDC. But we would also tell you that NCDC has finite resources, limited number of staff, and in the end, it's overwhelmed by this challenge that we're dealing with. And that is why it is important that taking the framework from NCDC is important as our national body dealing with public health issues. But ensuring that we capacitate local institutions would be central to it. And that's what brings me to the heart of the matter. This act and the bill, both the Act, the Quarantine Act, and even now the bill, gives governors and states very scant operational space to maneuver. And even the limited space that was given in the Quarantine Act is being taken away by this bill that we're currently considering. The bill takes away the only authority the governors have to take specific steps and measures in their doings during an outbreak of an infectious disease. A situation where state governors do not have any power to make regulations in their states in the event of an outbreak of an infectious disease, or to declare any part of the state an infectious area, is not only inimical to the country's federalism, but also a recipe for disaster which cannot be managed by NCDC. So, the situation will pose a challenge if states need to urgently make regulations to control the further spread of an infectious disease where the president is yet to do so. And we've seen that in our current situation. The president, in the COVID-19 regulations, restricted movement in only 2 states, Lagos and Ogun, including the FCT. And this would have been chaotic had this bill been in existence before this current pandemic, because the existing legislation governing infectious diseases and curbing the spread thereof. The state governors, in exercise of the powers vested in them by the Quarantine Act, have all taken steps to issue executive orders, because that is provided for in the Quarantine Act, to ensure the control and the spread of the virus in each of their states, since the regulations made by the president did not extend to the other 34 states. The only time it did was when we now advised the president via the Presidential Task Force on interstate boundary lockdown, so that the spread of the diseases could be restricted as much as possible to areas where the pandemic epicenter was at the time. So for us, we believe that there are a number of provisions in the bill that must be reviewed, and we would crave the indulgence of the Joint Committee to look into this. I have spoken about the powers, for example, and the work that the Director General of the NCDC has been doing. But we think, at the level of governors, that this bill appears to vest overbearing discretionary powers on the Director General of the Nigerian Center for Disease Control. Anyone who has read it would know what I'm talking about. And that is without prejudice, as I said, to the role that the NCDC plays and the hard work of the current leadership. But we all know, as Democrats, that it is always dangerous to vest uncontrollable powers on any one person. The bill empowers the NCDC to perform certain acts which are directly in conflict with constitutional guarantees to fundamental human rights. For instance, while Section 6 mandates the compulsory testing of persons on the mere suspicion of the Director General, Section 10(3) gives him express powers to use force to enter any premises without warrant. What is worse, the test in Section 6 will be at the expense of the person. So if you are forced to take a test, the individual is the one that must pay for the test, according to this bill, failing which he would be liable to stiff penalties. Section 15(3)(e) confers on the Director General of the NCDC the powers to authorize the destruction and disposal of any structure, goods, water supply, drainage, etc. Of course, I'm sure it is well-intentioned, but it is discretionary power that could be used without any restraint. Similarly, Section 47(1) confers discretionary power on the Director General to order any person to undergo vaccination or other prophylaxis. Under Section 70, the Director General or his agents cannot be sued even if his suspicions turn out to be unfounded. Again, Section 71 of the bill absolves the DG, any health officer he might have sent, any port health officer, any police officer, or any authorized person of any liability when acting in good faith and with reasonable care. We all now know what good faith and reasonable care means. We can all breathe, and we know that in another country, reasonable care could also, reasonable force could eventually kill somebody. So I believe the Honorable House would need to pay attention to this, because the use of good faith and reasonable care is not only subjective, but ambiguous, with high potential for misuse. I can go on and on, but the important point to make, and we have submitted this memorandum to the Honorable House, is that this is a well-intentioned bill, and we believe that it could very well incorporate a number of other elements, and our recommendations are as follows. 1. Provisions along the lines of Section 8 of the Quarantine Act should be inserted in the bill to allow state governors and local government chairmen the power to declare a place to be an infectious area and to make regulations, so that that power does not just reside in the Director General of NCDC in Abuja. If the governor has a reasonable fear that an area deserves to be declared an infectious area, it should be possible for that governor in the state to do that without waiting for the concurrence or directive of the NCDC. It is the position of the NGF that powers beyond those granted by Section 8 of the Act should be conferred on the governor so as to strengthen the ability to act in this regard. State governments should be given powers to establish state centers for disease control and appoint directors to work with the NCDC as its subnational unit. Currently, we do work with NCDC. They're very connected effectively with states, but that is not legal. It's just administrative, and I think it's important for us to begin to do this in a legal manner without necessarily reinventing the wheel. The discretionary powers of the President and the Director General of the NCDC should be reviewed with the aim of spreading same among the authorities of the 3 tiers of government. This will ensure that everyone is adequately involved in the efforts to confront any outbreak of an infectious disease. 4 provisions like Section 21(5) that are inconsistent with the Constitution should be expunged, and they are without more unlawful and cannot stand proper scrutiny. In any case, it is trite in law that the Constitution supersedes other regulations, and anything that is in conflict with it cannot stand. As we thank the Honorable Committee for this privilege to express our concerns and views on this matter, the Nigerian Governors Forum avails itself of the opportunity to renew to the Honorable Speaker and the House of Representatives the assurance of our highest consideration, and to also reassure you that we are constantly working with the NCDC and other experts in this area. We have a whole team in the Nigerian Governors Forum. Our health desk is full of experts, and we're willing to share them with the experts in the House of Representatives and the distinguished Senate Committee on Health in order for us to come out with a much more robust law at the end of the day. I thank you for this opportunity on behalf of all my colleagues, and want to reassure you that we're partners for progress and for the deepening of this engagement and preparation against all future pandemics. Thank you. God bless you.
Thank you so very much, Your Excellency. That was a very elaborate presentation. You are truly an intellectual in service. Thank you, sir. May I invite also for his remark quickly the chairman of Northern Governors Forum and the governor of Plateau State, Governor Simon Lalong.
Then that is actually, MC, that is a good one. It's like the governors are represented and really through the chairman of the Nigeria's Governors Forum. And on that note, let me just briefly say a very big thank you to the chairman of the Nigeria Governors Forum, by extension to each and every governor of the Federal Republic of Nigeria, for the time you have had to come and share with us some of your experiences. Like I have whispered into your ears, let me whisper to the ears of the people here, and even beyond, that by the presentations you made, it suffices to say that yes, as an institution, a legislative institution, we are quite aware that whatever we come to discuss or deliberate upon, reasons why we offer ourselves for public considerations of this nature is the fact that we have an inherent belief that we can be human in the course of our work. The belief that we can also share in the intelligence and the expertise of other people out there who are not necessarily members of the House of Representatives. Perhaps for reasons related to the cost of printing of posters, some of you decided not to come here and contest the members of the House of Reps. So that's the reason why we offer ourselves for public partnership, participation with people like you. And even with the presentations you have made, which of course most of them are professional and things we can also look at critically, I do not see us being very far away from each other, the position of the Governors Forum and the position of the National Assembly. But I have to say very emphatically that no matter what the cynicisms, no matter what the speculations, no matter what the spread of rumors, fake news, the leadership of this House under the able leadership of Right Honorable Femi Bajabiamila and other leaders as principal officers of the 9th House of Representatives, and I think by implication the 360 membership of our great House of Representatives, cannot and will not be distracted by this kind of cynicism. We must be allowed to do our work. We have said it publicly without any fear of contradiction that the fact remains that we are doing this in good faith. We don't have any self-serving interest. And that is why the Speaker in his normal way decided, oh, let's go for public hearing. Even if it was deliberate that we wanted not to go for public hearing, okay, you now say humbly, let's go for public hearing. It might have been an oversight, or perhaps our zeal to really quicken this legislation process because of the pandemic we are in. I remember even with the last time when we met with the officials of the PTF, with the SGF being the leader of that team, the DG NCDC was also there. He did not have any trouble, and I don't want to believe that he has any trouble with the bill except for some of the natural imperfections that you want to now come and share with us so that we come up with a fine legislation, fine legislative framework that will govern this crisis in the public sector. We never envisaged that we could have, what do you call it, COVID-19. We never envisaged that we have this kind of thing, these modern diseases that just come and travel away, far away from the globe and come into Nigeria. And therefore, as a legislative institution, we must have to take our responsibility, stand to do what is right, irrespective of whatever distractions. We can't be distracted. That is the position of the leadership, and that is the position of the entire membership of the House of Representatives. It is my belief that the selection of each and every member you have seen here on this committee, the joint committee, was deliberately done and designed by the leadership of this House, believing in their capacity, respective capacity. Some of them have very relevant professional backgrounds. Some of them are medical doctors. Some of them are gurus in the areas of legislatives, the likes of Woodil, the likes of Goro, people like my brother here, who is my consultant on legislative matters, the member from Lagos State, my brother. These are people whom I believe, putting all hands on deck, and in partnership with relevant sectors of our society, we will come up with a legislative framework that will be for the benefit of each and every member, each and every Nigerian, and for the general good of the people of the Federal Republic of Nigeria. I want to once again, on behalf of the Speaker and the leadership of the House, thank you most profusely for being here with us and sharing with us in honesty and trust what you think this bill should be. And I hope every other person that is coming to make a similar presentation will please do that with an open mind. Open mind. We all have the trust of the people of the Federal Republic of Nigeria in our hands, in various capacities of public service. I thank you all for being here, and I want to extend once again the gratitude and the happiness of the leadership for the time you have found to be part of this very important deliberations. Thank you, and God bless the Federal Republic of Nigeria.
Thank you, Your Excellency. Your Excellency, with that, I know you want to leave and join others at plenary, and of course, I have received a signal that also the governors want to leave. Before we allow them go, may I quickly invite the Chairman, House of Representatives Committee on Health Institutions, Honorable Dr. Pascal Obi, to please say thank you to the Speaker, the governors, and every other person that is here before we move to the technical session of this hearing.
Hello. Good afternoon, ladies and gentlemen. Is it working? Yeah. The representative of the Speaker of the Federal House of Representatives of Nigeria, ably represented by Honorable Hassan Adogwa, the Majority Leader of the House. My colleague, the Chairman, House Committee on Healthcare Services, Honorable Tanko Sununu, the Chairman, House Committee on Justice, Honorable Ugonna Ozuribo, Your Excellency, the representative of Nigerian Governors Forum, or the Chairman of Nigerian Governors Forum, Governor Kayode Fayemi, the man with very supersonic level of erudition, the Chairman of Northern Governors Forum, Governor Simon Lalong, and the Governor of Plateau State, the Chairman of various committees of health at the Nigerian Senate, 9th Assembly. Can see my brother, Senator Chukwuka Otaze, and Senator Yahaya Oloribe. I think let me beg to stand on the already established protocols. Well, I want to start by thanking God Almighty, who has made it possible for us to gather here this afternoon to kickstart the process of galvanizing views and opinions on how to synthesize or resynthesize a better, more encompassing, and more acceptable act of the National Parliament for the control of infectious diseases in our country. Let me start by thanking my colleague, the Chairman of House Committee on Healthcare Services, who has painstakingly and with very sense of maturity, conducted all previous preliminary activities that culminated into this our gathering here today, the opening ceremony. My brother, you've done so well. In similar vein, I thank my younger brother also, the chairman of Committee on Justice, who had to defy all odds and obvious challenges occasioned by the COVID-19 induced interstate lockdown, and traveled all the way from Imo State just to participate in this all-important exercise. Honorable Ozuribo, I thank you so much. Then it will amount to the height or summit of parliamentary astigmatism if I refuse to recognize the presence and contributions of these well-meaning Nigerians who have gathered here today. I want to assure you that your contributions or opinions will never be in vain. It will never be an effort in futility. We are here to represent Nigerians. We are not representing ourselves. We want you to be rest assured that at the end of the day, all you have said, the papers you have submitted, the opinions you have expressed, they must all be taken into consideration by the time the law we are talking about, the bill, metamorphosizes into a law. Just be rest assured. We are here to represent Nigerians. All decisions that will be taken must be in the best interest of Nigeria and Nigerians. On that note, I want to pray God Almighty to grant us all journey mercies as we exit this hall and head to our respective destinations at the end of this wonderful deliberation. Thanks and God bless everybody. Thank you.
Thank you, sir. With that, we have come to the end of the opening ceremony of this public hearing. We will allow the representative of Mr. Speaker to take his leave while we return and move straight to the technical session of this public hearing.
To the 11th of June 2020, the Joint House Committees on Healthcare Services, Health Institutions and Justice will conduct a two-day public hearing, a bill for an act to repeal the Quarantine Act and enact the Control of Infectious Disease Act. The committee hereby invites memoranda from the public and particularly from key stakeholders in the health sector, security, justice, international development, civil society, media, transport, traditional and religious institutions. Members of the public and stakeholders should submit one soft copy. Director, Clerk Committee on Healthcare Services in H102, White House, House of Representatives Wing, National Assembly Complex, Abuja, Monday, the 1st of June 2020. Receipt of the memoranda will end on Friday, 5th of June 2020. Please note that the public hearing will be conducted in line with the COVID-19 Nigerian Center for Disease Control NCDC guidelines, with strict adherence to wearing a face mask and observance of social distancing. The general public is also advised to follow the public hearing on the following social media accounts: YouTube Live, Facebook, and Twitter. For further details, contact the Deputy Director, Committee Clerk, Mrs. Joyce Aniete Umorum, on 080-659-23157 or email healthcareservices.nas@gmail.com. This message is from the Joint House Committee on Healthcare Services, Health Institutions and Justice, Federal House of Representatives, Nigeria. On the 10th to the 11th of June 2020, the Joint House Committees on Healthcare Services, health institutions, and justice will conduct a two-day public hearing, a bill for an act to repeal the Quarantine Act and enact the Control of Infectious Disease Act. The committee, media, transport, traditional and religious institutions. Members of the public and stakeholders should submit one soft copy in a flash drive and 50 hard copies of each typed memorandum, which should be addressed to the 1st of June 2020. Receipt of the memorandum will end an observance of social distancing. The general public is also advised to follow the public hearing on the following social media accounts: YouTube Live, Facebook, and Twitter. For further details, contact the Deputy Director, Committee Clerk, Mrs. Joyce Aniete Umorum, on 080-659-23157 or email healthcareservices.nas@gmail.com. This message is from the Joint House Committee on Healthcare Services, Health Institutions, and Justice, Federal House of Representatives, Nigeria. On the 10th to the 11th of June 2020, the Joint House Committees on Healthcare Services, Health Institutions, and Justice will conduct a two-day public hearing, a bill for an act to repeal the Quarantine Act and enact the Control of Infectious Disease Act. The committee hereby invites memoranda from the public and particularly from key stakeholders in the health sector, security, justice, international development, civil society, media, transport, traditional and religious institutions. Members of the public and stakeholders should submit one soft copy in a flash drive and 50 hard copies of each typed memorandum, which should be addressed to the Deputy Director, Clerk Committee on Healthcare Services in H102, White House, House of Representatives Wing, National Assembly Complex, Abuja, Monday, the 1st of June 2020. Receipt of the memoranda will end on Friday, 5th of June 2020. Please note that the public hearing will be conducted in line with the COVID-19 Nigerian Center for Disease Control NCDC guidelines, with strict adherence to wearing a face mask and observance of social distancing. The general public is also advised to follow the public hearing on the following social media accounts: YouTube Live, Facebook, and Twitter. For further details, contact the Deputy Director, Committee Clerk, Mrs. Joyce Aniete Umorum, on 080-659-23157 or email healthcareservices.nas@gmail.com. This message is from the Joint House Committee on Healthcare Services, Health Institutions, and Justice, Federal House of Representatives, Nigeria. On the 10th to the 11th of June 2020, the Joint House Committees on Healthcare Services, Health Institutions, and Justice will conduct a two-day public hearing, a bill for an act to repeal the Quarantine Act and enact the Control of Infectious Disease Act. The committee hereby invites memoranda from the public and particularly from key stakeholders in the health sector, security, justice, international development, civil society, media, transport, traditional and religious institutions. Members of the public and stakeholders should submit one soft copy in a flash drive and 50 hard copies of each typed memorandum, which should be addressed to the Deputy Director, Clerk Committee on Healthcare Services in H102, White House, House of Representatives Wing, National Assembly Complex, Abuja, Monday, the 1st of June 2020. Receipt of the memoranda will end on Friday, 5th of June 2020. Please note that the public hearing will be conducted in line with the COVID-19 Nigerian Center for Disease Control NCDC guidelines, with strict adherence to wearing a face mask and observance of social distancing. The general public is also advised to follow the public hearing on the following social media accounts: YouTube Live, Facebook, and Twitter. For further details, contact the Deputy Director, Committee Clerk, Mrs. Joyce Aniete Umorum, on 080-659-23157 or email healthcareservices.nas@gmail.com. This message is from the Joint House Committee on Healthcare Services, Health Institutions, and Justice, Federal House of Representatives, Nigeria. On the 10th to the 11th of June 2020, the Joint House Committees on Healthcare Services, Health Institutions, and Justice will conduct a two-day public hearing, a bill for an act to repeal the Quarantine Act and enact the Control of Infectious Disease Act. The committee hereby invites memoranda from the public and particularly from key stakeholders in the health sector, security, justice, international development, civil society.
Thank you.
Thank you, Mr. Chairman, Co-Chairman, honorable colleagues, invited stakeholders. My name is Boniface Emerengwa. I represent the good people of Ikweremo Federal Constituency in Rivers State. I'm a member of this committee.
Chairman, Deputy Chairman, honorable colleagues. My name is Joe Robert Auna. I speak for the people of Kiwande and Oshongo from Benue State.
Right Honorable Chairman, Honorable Deputies, my honorable colleagues, our invited guests, I am Honorable Engineer Muhammad Al Udil. I represent Udil Garko Federal Constituency. I'm from Kano State. I'm member of Healthcare Services and Healthcare Institutions Committee. Thank you.
Honorable Chair, Honorable Deputy, our guest. Like my brother here, I'm also from Kano State. And my name is Comrade Amin Suleiman. I represent Page Federal Constituency. Thank you.
Thank you. My chairman, other co-chairman, other deputy chairman, my colleagues, invited guests, I am Honorable Dr. Samuel Babatunde Adejari. I represent all the good people of Agege Federal Constituency. I'm from Lagos State. Thank you.
Yeah. The co-chairman of this great committee, my dear colleagues, our very distinguished guests, I am Chinyere Igwe, PhD. I represent Port Harcourt 2 Federal Constituency of Rivers State.
I am from Kogi State.
The chairman, our two chairmen, my respected colleagues, our invited guests, I remain Right Honorable Kabir Al-Asarurum. I represent Rano Bunkure Federal Constituency. I am from Kano State.
Mr. Chairman, Deputy Chairman, our invited guests, Honorable Chinedu Benjamin Obidigwe, Anambra East and West, Anambra State Member, House Committee on Health Care Services. Thank you.
Mr. Chairman and the co-chairman, fellow colleagues, my name is Boluga Ikemgoju. I'm a pharmacist. I represent the people of Okutukukwairole Federal Constituency. I'm from Ondo State and I'm a member of both Healthcare Institution and Healthcare Services Committee. Thank you.
Co-chairman, honorable colleagues, our guests. I am Dr. Martins Oke. I represent Igbe Titi, Ozo, and Federal Constituency of Enugu State. I'm the deputy chairman of the Committee on Health Institutions. Thank you.
Mr.
Chairman.
Okay.
Honorable Chairman, Health Services, my brother Chairman, Health Extension, honorable colleagues, distinguished ladies and gentlemen. My name is Honorable Ugonna Oziribo. I'm from Imo State. I represent the good people of Unkwere, Mwangele, Isu, and Njaba Federal Constituency. The chairman has Committee on Justice.
Hello. My co-chairman, my name is Honorable Dr. Pascal Chigozie Obi. I represent the good and very, very amiable people of Idato North, Idato South Federal Constituency. I'm from Imo State, and I'm the Chairman House Committee on Health Institutions. Thank you, everybody.
Thank you. The co-chairman, my elder brother, Chairman House Committee of Health Institution and Justice, Deputy Chairman here, President, honorable members, Head of Government Parastatals, the President of Nigerian Labour Congress, President of all other associations, let me specifically recognize also the Nigerian Medical Association and also my teacher who has a triple cap here. He's also the chairman of House Ad hoc Committee on COVID, a member of my committee, and also my lecturer right from the university. It's a pleasure for me to work under him as a student. And today now we're also working together as a colleague. Sir, you deserve to be recognized, and thank you very much. Yes. My name is Honorable Dr. Yusuf Tanko Sununu. I represent Yauri Shanga Engeski Federal Constituency, and I'm from Cape State. Thank you.
Thank you, Mr. Chairman. Mr. Chairman, for us to save time, we will skip the introduction from stakeholders, but we'll want every stakeholder to please introduce him or herself before the presentation. I think that will be better, Mr. Chairman. Sir, before I hand over the microphone to the chairman, let me quickly inform our stakeholders that the chairman will introduce the deputy chairman who will read out the rules of presentation for this public hearing. But I want to give my own rule, which is just one. With your permission, Mr. Chairman, any stakeholder that is presenting should please come to the podium for the benefit of our cameramen. Please, that's a request. Thank you very much, Mr. Chairman. On this note, let me seize this opportunity to thank Mr. Chairman for allowing me to anchor the opening ceremony of this public hearing. Mr. Chairman, we're in the technical session and the microphone is yours. Thank you very much, sir.
Thank you very much. First of all, let me also welcome once again everybody to this technical session. And also let me really confess, I'm one of the privileged chairmen, guided by my elder brother who is an elder in Nigerian Medical Association, former commissioner, former house member, and then tutored by also still by my teacher in the committee. So I have a double advantage. And also my senior colleague also, Honorable Archbong. So I think my conduct will be as expected to justify the work they have done in tutelage me to this level. So we are going to do it with utmost respect of everybody. We are going to be fair, transparent, and very objective in our dealing. And let us also, all of us, interact as a family. And in family, wherever you meet, you are distant, the guideline is you must show respect to each and everyone's idea. We are all coming from different backgrounds, so we may have different perceptions as in matters that we are going to address. But what is most important is we must respect each and everybody's idea so that we can move together and we can have a smooth conduct of this public hearing. In the end, let us, all of us, pray that we may have something that can assist this country, that we can all of us be proud to say we participated actively in making what seems to be a dirty baby a very good one that will benefit all of us. It's always my belief that nobody should throw away a baby with bath water. You can clean that baby as much as possible. And in the end, you will have what you'll be proud of to say, this is my baby. With that, I want to, for the benefit of our clerk is also here. Please kindly introduce yourself quickly so I can proceed.
Honorable Chairman of the Joint Committee, Chairman of other committees present, Deputy Chairman, House Committee on Healthcare Services, Honorable members, our invited guests. My name is Joy Tumoren. I'm the clerk of the committee and a director in the House of Reps. You are welcome to this public hearing.
Well, it's my pleasure to invite my elder brother, a distinguished legislator by excellence, and also consultant to House Leader in legislative matters, to please read the guidelines for this presentation.
Thank you, my humble, reliable, honest, dependable chairman, co-chairman, my colleagues, invited guests. Mine is simple. It's just to read out to read out rules of this public hearing. They are simple, but they are very important and critical to this sitting. One, you cannot speak unless you are recognized by the chairman. Two, all cell phones must be put on vibration or switched off. Three, sorry. Okay, let me start again. One, you must speak unless you cannot speak unless you are recognized by the chairman. Two, all cell phones must be put on vibration or switched off. Three, strict observance of social distance during public hearing. Four, you can only approach the chairman when called upon to do so. Five, for male and female conveniences, please approach the ushers. They're outside the doors. They will take you there. These and other NCDC COVID-19 guidelines are applicable during the public hearing. Each presenter will present for 5 minutes. Thank you. God bless you all.
Thank you, Madam Deputy. Please, invited guests, we have had rules governing the conduct of this meeting. Any observation or addition? Please, quickly, so that we can round up this rule. Because if we adopt that rule, it's standard. We're going to work within that guidelines. So, in the absence of any addition or subtractions, it means all of us agree with that rule, and we're going to operate within that. I gave you the opportunity now. You didn't raise up your hand. So, let's continue.
With the apology, sir. I'm just requesting. I say with the apology, sir, for not raising my hand early enough. Could the chairman please approve that each presenter should at least be given up to 7 minutes? Thank you, Mr.
House,
Chairman.
once an issue is ruled, we cannot go back to it. And that's why I gave you the opportunity to raise your hand, and you haven't done that. So please, let's accept what we have to guide our conduct. Director General's presentations. We then follow it up by NAFDAC, then Federal Ministry of Health, so that everybody, Federal Ministry of Justice is around. I learned that Federal Ministry of Justice. Please, is there a representative around? Okay, then by Federal Ministry of Justice, then Nigeria Labour Congress in that order. We have selected 4 now that will make their presentation and will proceed. DG, please, you have the floor. Can you, for the benefit of the cameramen?
Chair and honorable members, let me crave your indulgence. The honorable minister has just gotten in touch with me and has craved the indulgence of the House that we present together tomorrow because of the FEC meeting he's at the moment. So I will crave your indulgence to start the session tomorrow with presentations from the Ministry and the NCDC. Your kind permission, sir.
Honorable members, you have heard the request of the Nigeria Center of Disease Control and Prevention, Director General. Is it in our interest of to suspend this? Okay, your request is granted. DG NAFDAC, please can you make your presentation? Because of this, you can come off this. You have 5 minutes as agreed to go straight to your point and make your presentation. The deputy chairman will keep the time so that we can strictly adhere to time. Once you are at the microphone, it means your time starts.
Honorable Chairman of the Healthcare Services, members of the committee,
members of the media, civil society, ladies and gentlemen. It is with sincere appreciation that NAFDAC accepts the invitation of this honorable committee to make a presentation on the Control of Infectious Diseases Bill 2020. The National Agency for Food and Drug Administration and Control is empowered by Section 5 of the NAFDAC Act, Cap N1, Laws of the Federation of Nigeria, LFN 2004, to, among other functions, regulate and control the importation, exportation, manufacture, advertisement, distribution, sale, and use of food, drugs, cosmetics, medical devices, packaged water, and chemicals. While the agency aligns with the intent behind the Control of Infectious Diseases Bill 2020, which is for the purpose of preventing the introduction into and spread in Nigeria of dangerous infectious diseases, we wish to address certain provisions in the bill and the possible effect on NAFDAC regulatory functions. Having perused the bill, we have made certain observations and a proposed redraft to the affected section as follows. 1. Part 1 of the bill, administration. NAFDAC recommends that the administration of the Control of Infectious Diseases Bill be administered by competent authorities, including the Director General NAFDAC and other Director General subject to the directive of the Minister. The redraft will be as such, except as otherwise provided by the Act. The Director General of Nigeria Center for Disease Control, NCDC, and Director General NAFDAC shall, subject to any general or special directions of the Minister, be responsible for the administration of this Act. Number 2, Section 11(1) provides the Director General may, by written notice, order the destruction of any animal and the disposal of any food or water wherever found, if he considers such to be a source of transmission of infectious diseases. NAFDAC wishes to point out here that NAFDAC is empowered by the provision of Section 5 of the NAFDAC Act to advise the federal, state, and local governments, the private sector, and other related bodies regarding the quality, safety, and regulatory provisions on food, water, and other regulated products. In this instance, NAFDAC's recommendation is that the NCDC should collaborate with NAFDAC in the destruction and disposal of such food and water for efficacy and effectiveness in ensuring food safety in Nigeria. Redraft. The Director General NCDC and Director General NAFDAC shall order the destruction of any animal and the disposal of any food or water wherever found, if they consider such to be a source of transmission of an infectious disease. Number 3, Section 17(1) provides, if the Director General has reason to believe that there exist on any premises conditions that are likely to lead to the outbreak of or spread of any infectious disease, he may, by written notice, prohibit Section B, prohibit the said distribution of food and water in the premises for such period as may be specified in the notice, and may require the owner or occupier of the premise to 1, cleanse or disinfect the premises in the manner and within the time specified, 2, carry out such additional measures as the director may require in the manner and within the time specified. We also state here that by virtue of Section 5A, NAFDAC Act, the agency is empowered to regulate and control the importation, exportation, distribution, advertisement, sale, and use of food and other regulated products.
Okay, thank you, DG. We have your memorandum.
Thank you so much, sir. We have already submitted it.
Before we go, please, honorable members, is there any clarification that you want to obtain from the presentation of DG NAFDAC? Anybody seeking clarification? Can please take your leave.
Thank you, sir.
If you present, please you take your leave because of the. Thank you very much. Yes, the NLC.
Well, thank you very much, Chairperson, and let me respect all other protocols and also inform you that I will be speaking on behalf of many organizations. Some of them have memos already, but we'll try to consolidate all the memos. One of them is Alliance on Surviving COVID-19 and Beyond, which have been listed on item 29, and the Nigerian Labour Congress, Trade Union Congress, all our affiliates numbering more than 70. I will therefore be speaking, and therefore I want to crave your indulgence. Well, Mr. Chairman, I think you recognize also my representative, Dr. Haruna Meshelia from Askira Uba Federal Constituency. He's not only my representative, he's also, I think, my mentor, having served directly under him. So I think it's a worthy recognition. And I think I can hide under that leverage. They then try to make this presentation. Let me start by appreciating the fact that this public hearing is desirable. Because of the fact that this bill has generated a lot of interest across Nigerians, and many Nigerians certainly will be interested, and that's why it's important for mass-based organizations like our own to be given space to present the view of our people. And let me also say that any opposition to the provisions of the bill should not be seen as an opposition to the House, because this is the hallmark of modern democracy. People should be able to hear their views, and those views should be accommodated. And because of the fact that you remember that the last pandemic was between 1918 and 1920. But the quarantine bill we are looking at was promulgated in 1926. So clearly speaking, time and space have allowed us to do a proper job. And I think what we are requesting for is that proper things should be done so that all of us will be safe. The first issue I want to posit is that rights are important and inseparable. Some are so fundamental that they have to attain the status of being the hallmark of constitutional democracy. And therefore, in making laws, we must also safeguard laws, our rights that are already fundamental. And therefore, our presentation will be premised on some of those provisions that we think fundamentally they are going to infringe on existing rights, which I think the Governors Forum have tried to highlight some of them. We have made about 17 observations under the presentation, and this actually is section by section. And let me try to take Mr. Chairman to the first one. The first one is actually on the first schedule, which said the categorization, particularly of the diseases under infectious diseases. And this to us is very worrisome because of the fact that we recognize that malaria and typhoid have been added. If I will be quarantined and my property will be confiscated, including forceful detention, I don't think any Nigerian will be spared. So clearly speaking, I think those are areas that we need to look at very well and address them. The second one is also under Section 5, dealing with public health surveillance. As a disease surveillance myself and as an epidemiologist, I know that those issues have been also adequately taken care under the public health laws of the Federation, which existed in the past. And I think it's important that we look at also those laws while we are trying to amend the Quarantine Act and also trying to put new processes in place. Particularly, we will subscribe to the rejection of this provision, which allows any public officer to subjectively and arbitrarily stigmatize and conduct and conclude that any person has contracted an infectious disease. If, for instance, we take the case of malaria and typhoid, which is included, and even any other disease, to say that subjectively you will then be forcefully quarantined, because we must also align these issues with the provisions of our law. And those provisions have been tested severally. In fact, it has been tested that the issue of even for people to access and accept Medicare is a matter of choice. And I think these have been tested by our law. So clearly speaking, I think there are fundamental issues that have to do with law and practice, and also fundamental right of citizens that we need to actually accommodate in these laws, and we have listed them to be about 17. I want to take us to the next one, which I think is the issue of isolation of certain persons, section 13 and 14. It is shocking that health conditions such as malaria, typhoid, etc. are categorized as grounds for arrest, detention, and isolation at discretion of the DG, rather than stigmatizing or criminalizing victims of those common but deadly health conditions. We urge the National Assembly to put in place laws and measures that will make Nigerians free from malaria, free from typhoid, and thereby making sure that every Nigerian is able to access quality health care. The other issue I refer you to is particularly under Section 16, abatement of overcrowding. Section 16 of the bill essentially criminalizes overcrowding accommodation. Yes. Well, thank you. I thought I can hide under the leverage of the fact that I'm delivering more than one paper, and I thought you will give us that opportunity, but no problem. I told you 3 organizations. Yes. We have consolidated the presentation into one.
Mr. Chairman, we move.
Thank you very much.
Okay.
Well, thank you very much, Chair. Thank you. Let me then go to the issue of Article 11, which states that parties to the present covenant recognize the right of everyone to adequate standard of living for himself and his family. We have tried to proceed that those laws, as I said earlier, must recognize already established laws that Nigerians have and are supposed to enjoy. And therefore, we are to enforce those laws, not to take them away, because some of those laws are very fundamental. And particularly Section 17 and 18 imposes public health burden. The failure to discharge such a burden ought not to be criminalized or charged as a debt in view of the obligation of government to citizens as far as provision of health care is concerned. And therefore, I think this is one issue that I think we shouldn't shift the goalposts, we shouldn't shift the burden and criminalize a worker that is actually, or a citizen that is actually undergoing certain element to say that, well, he's been criminalized and therefore you can just charge him for actually being ill. Let me take us to Section 20, control of occupational trade and businesses. We consider this as a direct affront on the right of life of average citizens, and in particular the means of sustaining life. The power to take away the means of livelihood of average person ought not to be reposed in the hands of an unelected person. It can only be exercised within the context of a contemporary period of emergency as prescribed under the Constitution, which ensures that the democratic and moderating role of the National Assembly, and therefore we reject certainly the provision of Section 20 and all other related sections in its entirety. And I think we must craft a law that actually respects this fundamental right. Lastly, let me go to Section 23, which authorizes police officer or any other authorized person to then also arrest any person suffering from any infectious disease from the streets, public place, shop, and public transport, and to take such a person to a hospital. We believe that this is an invitation to anarchy and poses a major threat to the right to liberty of citizens expressed guaranteed in Section 35 of the Constitution. This competence of the police officer and enforcement officer to come to the conclusion that the citizen he or she meets on the street or in a public place suffers from an infectious disease is highly suspicious, and I think is subjective, to say it at the least. And therefore, I think we must look at some of those provisions to make sure that the right thing is done. So clearly speaking, I think, Mr. Chair, we have highlighted about 17 areas where we think that if this law is to conform with the present-day democracy, then we must respect those laws, and we must also ensure that we are not hijacked. Lastly is the issue of compulsory vaccination or immunization. Lastly, Chair, the issue of compulsory immunization or vaccination. I think this is also a very contentious issue where Nigerians are actually also concerned about it. It should not also appear in our laws that we must compulsorily then vaccinate people against any of those infectious diseases. Thank you very much, Mr. Chair. I so submit.
Those associations that made us to
yes,
add
please.
time so that we cannot also call them again.
Alliance on Surviving COVID-19 and Beyond, ASCAP, which is ably chaired by Femi Falana, SAN, which we are co-chair and he ought to have presented today, but I'm presenting on his behalf. Then the Nigerian Labour Congress, which has also key affiliates in the health sector, National Association of Nigerian Nurses and Midwives, Medical and Health Workers Union of Nigeria, yes, and the Trade Union Congress of Nigeria. Thank you very much, sir.
We'll see you so that you can give out the list.
Thank you very much.
So that we can exclude them. I think that's about this.
Thank you.
Okay. The representative of Ministry of Justice. Yes, please can you come?
The Honorable Chairman, sir. Distinguished Honorable members present and distinguished ladies and gentlemen. My name is Suleiman Dawodu. I am the Executive Secretary of the Administration of Criminal Justice Monitoring Committee domiciled within the Federal Ministry of Justice. I also consult for the European Union funded program Rule of Law Anti-Corruption, ROLAC, and thereby seeking indulgence of the chairman also to grant me about 7 minutes so that I can consolidate both positions adequately, sir, with respect. Sir, to Red Justice and ROLAC, yes. Okay, sir. Well, basically, in relation to justice position, I only will say this on record that position of justice is to harmonize the position of both the Senate and House version as it were presently going on. And by virtue of my position, I will have the benefit of also being part of the technical committee that is assisting the Senate and also in reviewing their bill, their version, current version. And also in the House, we have been invited by the civil society Yaga, and we have worked extensively with the chairman on this. So I will be saying, in relation to justice, my Honorable Attorney General is close relationship, engagement, I should say, with the chairman of the Senate Committee on Public Health and Health Service, which is Senator Utazi, and he has been briefed. He's endorsed that Senate version as it were presently because that's the one that is actually pre-knowledge. And he has advised the legal drafting department of the Federal Ministry of Justice to work closely with the Senate committee review, which is already going on, also going on tomorrow. But having said that, it is also recognized by virtue of my position, having sat with the committee that was reviewing the House of Reps version, we have used that benefit to maximally to ensure that issues arising are all consolidated and for the purpose of harmonization, that will be smooth at some point when we get to that point. But the basic recommendation across board, before I take up all my time, that we have recognized or identified in relation to matter of structure and constitutionality of what we have in the bill presently, both in the House and in the Senate version. And in terms of the structure, the long title itself we have proposed, and both sides have agreed that rather than the long title of what we have, control of infectious disease, it should be more of a public health emergency bill. And that position has been put to both committee. I think that's been agreed more or less subject to the larger committee's adoption of that. So apart from the long title, we have issued the objectives not stated in the The objective is not stated in the House version as it is presently, and that we have introduced, we have plainly put that to the review team that is looking at it. I have sent that off to them. Again, in terms of the powers of the DG, which is coming up constantly by everyone, I'm aware that in the Senate version, we're looking at more of the issues to do with in the House version. It should be more of the committee driving that, along with the DG who might be member of that committee. So that is that itself will allay the concern of most people in terms of the overruling power of the DG as presently in the committee, in the bill presently. So then for the committee itself, we will replicate what we have as a PTF, which will be appointed by the current PTF and appointed by the president. A funding should also be created, which we have also put to the committee reviewing that, so that the committee will have a source of funding that is guaranteed, that might also be budgeted for in times of need. Other than that, the governor, the chairman of the Governors Forum also raised this issue of states, how they come into the picture. The position was that they were going to be adopting the federal law or act, as it were, at some point. But the question will be, how do we then ensure the coordination? And I'm sure some of my colleagues will be able to deal with that issue.
We are going to look at your submissions. It's just a highlight.
Okay.
Thank you very much.
Okay, thank you. Thank you. Sure.
My name is Dr. Ekbe Phillips Uche. I'm the Secretary General of Nigerian Medical Association. The co-chairman and members of the House Committee on Health Services, Health Institution and Justice, fellow stakeholders, and members of I bring you greetings from Nigerian Medical Association, especially the NMA president, who is unavoidably absent. The NMA Association wishes to override the need for a strong legislation, wishes to say the overriding need for a strong legislation to back programs and activities connected with the prevention and containment of a serious health emergency like the COVID-19 pandemic. We summarize our thoughts in these thematic areas. This is the synopsis of our memorandum of understanding we submitted, thus we present the abridged version. The following questions ought to be asked. Why the bill? Why the urgency to pass it into law? Why the public outcry? Remedies to assuage the public outcry? All that happened to the bill from the time of conception, drafting, consideration in the House of Rep, and even now. These are the things we are discussing here. There is need for an efficient law with strong deterrence, but congruous with the provisions of the Constitution, more especially such law ought to recognize the federal structure of the nation and shouldn't engender the conflict between the national, subnational government in executing their statutory function. Avoiding too much powers to an individual or an agency. Recognize and position administrative and judicial reviews to check arbitrariness of officers of state. There is need for conscientious administrative review for executing the particular function which changes every other thing and triggers of the implementation of content of the law. The President, on the advice of the Minister, in agreement with the National Council on Health, may declare provision couched like that and flowing from the collective decision, making will assuage the anxieties of those who fear conspiracy of state authorities to deal with offensive to political opponents. As such, at this level of state, such body could be constituted in the State Council of Health as it exists, or the medical officers of health, or the local government council of the state. In line with the Constitution, such a health bill should recognize the role of the federal government in securing the nation at the borders and at the ports, of entry and exit against the aggression of biohazard agents and their carriers. This may come from the specific provision of the law or regulations formulated to take care of specialized areas that the law may not have anticipated. So a provision in the law granting the federal authorities to formulate such guidelines or protocols with appropriate administrative or judicial oversight will solve unforeseen deficiencies in the law or emerging developments. On the other hand, the law should, without prejudice to the provisions stated therein, allow the states and local government councils to promulgate and implement the regulations and protocols encumbered by the overbearing federal might, unless where there is a convincing evidence that such subnational authority is not acting in the interest of public safety or good. In light of existing realities, the association proposes that a high-level multi-sectoral ad hoc joint task force be created in this bill to be the governing authority. Such a task force will be inaugurated upon the declaration of health emergency and dissolve upon the declaration that ends the emergency, and can delegate duties during that health emergency. The balance between protecting public health and human rights, the necessity of public enlightenment and awareness creation through meticulous and responsible civic engagement to move fast ahead of negative sentiments and misinformation about infringement on rights of citizens cannot be overemphasized. If this is successfully done, provisions such as those mandating appropriate officials to inspect any premises, declare premises as infected area, isolate people, restrict movement, and conduct medical examination may be better appreciated as necessary to protect public health in the public interest. The certain sensitive and sensibilities are already provoked so far is an understatement. The whole society approach is very instrumental to achieving this language of communication and strategy here. In line with the above, NMA opposes the...
Time up.
All right, thank you, sir.
Look at your submissions.
Last one, sir.
Please, next 6 associations.
Sir, can I have 1 minute, sir, to just give a very important point? 1 minute, sir. All right, sir. Thank you, sir.
If you have something of interest, please go direct to the highlight. There is no need. So please,
yes, sir.
Please, your time is up, sir.
Thank you, sir.
Yeah. Yes. They have made their submission now, they are not here. Yeah.
Take the list of who are here and call so that you don't speak.
Well, that's the what's this now? Which one? Okay, this one. Okay. Okay.
Those are marked.
Okay.
So they don't call.
Okay. Yeah, we are calling for so wait, we'll call you. Optometrists are dispensing a board. And then the president of Nigerian Optometrists Association. We have 3 now, Veterinary Council of Nigeria. We also have Jamaat Nasrul Islam, 4. And then we have National Association of Catholic Lawyers.
If you are here, please indicate.
Indicate you are around, okay. And then finally, Nigerian Veterinary Medical Association. Okay. Please, Veterinary Council, please, can you come forward? Oh, yes, she's already there. So it's okay, please. That's all right. So, what's the problem? Huh? Let me call you now.
Please, there's a list that we should follow now.
The chairman and honorable members and the House, good afternoon, everybody. My name is Professor Ms. Sebele Bridgetu Zodike. I'm the registrar of optometrists and dispensing
Please
opticians
go straight to your point so that you cannot call off time.
Board of Nigeria. We have considered as a profession, optometry and dispensing opticianry, we considered the bill and we came up with the following recommendations or observations. The first one, the provision of the bill in clause 4 to the effect that every medical practitioner who has reason to believe or suspect that any person attended or treated by him is suffering from a prescribed disease, infectious disease. This clause supposes that it is only the medical practitioners registered under the Medical and Dental Practitioners Act that may attend to or treat person or persons suffering from or who are carriers of infectious disease. There are other healthcare providers, like optometrists, who may also attend to or treat person or persons suffering from or who are carriers of infectious diseases or disease. We therefore recommend that the term medical practitioner should be expunged and replaced with healthcare provider. This should also apply anywhere else the term is used, specifically clause 48, clause 50, clause 51, and 79, and any other place. The provision in the same clause, clause 4, with the phrase, a person in a prescribed class, is rather ambiguous and should be expunged and replaced with a healthcare provider. In clause 8, it is a submission that the term healthcare professional or professionals be expunged and replaced with the term healthcare provider or providers where and where else it occurs. Clause 80, we have the interpretation in which the term medical examination includes carrying out by a person. It is our submission that the word person be expunged and replaced by the term healthcare provider. Also, the term medical practitioner be expunged and replaced by healthcare provider. And the healthcare provider we are talking about here means a person providing healthcare services under the National Health Act or any other law. This is according to National Health Act 2014, Section 64. Further to this, the term nurse also should be replaced with a healthcare provider. In the first schedule, infectious diseases, we wish to make the case that trachoma, an infectious disease of the eye, be included in the list of infectious diseases. Trachoma is a disease of the eye caused by infection with bacterium chlamydia, Chlamydia trachomatis. It is a public health problem in 44 countries and is responsible for blindness and visual impairment of about 1.9 million people. And it affects mainly the children who gets infected and reinfected. And when they are blind, you can imagine the life implication of that, of our children being blinded at the early stage. The infection spreads through personal contact, also via hands, clothes, and beddings, and by flies that have been in contact with the discharge from the eyes and the nose of the infected person. We also wish to make a case that viral hemorrhagic fever, that is Lassa fever, which is caused by Lassa virus, also be included. We know the problem that Lassa fever has caused, especially in the northern part of the country, in terms of mortality and all that. In conclusion, we wish to recommend that the bill be reversed with the recommendations we have proposed and passed into law for the protection of the health of Nigerians. Additionally, we urge this honorable committee committee is to also consider the issues of alleged human rights infringement raised by some public commentators and ensure that the law will ultimately protect the health of Nigerians. Thank you very much.
I think if we can follow our example, we will finish before.
Okay.
Your time starts.
Yes, sir. The Honorable Chairman, sir, and all members of the committee, I would like to stand on the existing protocol. I'm here standing for the Veterinary Council of Nigeria as the President of the Council, which is a regulatory agency of the Federal Republic of Nigeria, established initially by an ordinance in 1952, updated by Act of Parliament, named as the Veterinary Surgeons Act of 2004 as amended. The Council has the mandate to basically entail the coordination, overseen, and regulation of all veterinary professional practice in Nigeria. The bill of infectious disease bill that we're discussing, sir, it is, we have found out, the Council has found out that there is a lot of contradicting sections in that bill, which is conflicting with the Veterinary Surgeons Act, the Animal Disease Control Act, and the Nigerian Agricultural Quarantine Services Act. In part 2, section 5 of the Control of Infectious Disease Bill, when they talk about here in that section, it is in conflict with section 8 of the Animal Disease Control Act. While also part 2, section 2 of the Control of Infectious Disease Bill also contradicts. They made mention of humans and animals. There is no way somebody that is not trained, that doesn't have the professional competence, will control animals. So the Council is requesting this Honorable House to delete and let it be only persons, not humans, not animals. So the word animals should be deleted to it, because when we look at it also, and the destruction and disposal of infected animals, food and water, it also conflicts with section 9 of the Animal Disease Control Act. And then also, most importantly, the definition of quarantine is very ambiguous in this bill, because already we have the National Agricultural Quarantine Services. So the definition should be amended to be human quarantine, not general quarantine, unless if other sections of the bill are corrected, where you have the CDC, DG, can, subject to condition of research, as he deems fit, appoint any health officer. The Council also want it to be relevant health officer. We propose the word any should be replaced with relevant to avoid improper exercise of discretion. For instance, a human medical officer is not trained to play veterinary functions. It is also pertinent to that all these are in consonance with recommendation by the World Organization for Animal Health, that's the OIE, World Trade Organizations, Food and Agricultural Organizations. So our prayer, Honorable Chairman, sir, is that the council is seeking that all this, we are not saying that the bill should not be presented, approved, but then it should be approved with all the highlighted contradictory sections of this bill. Thank you very much.
Jamaat Nasrul Islam, we have called you now, so please come forward. Which association did we call? Christian Council Lawyers. Christian Lawyers Association. Catholic Lawyers Association. I've called you, so you get ready to prepare. Once you finish, you come up.
Good afternoon, ladies and gentlemen. The Jamaat Nasrul Islam
Please,
National
your time starts,
Headquarters.
sir. Go straight to your point, because no time to...
The Jamaat Nasrul Islam National Headquarters wishes to state its position unambiguously on the proposed infectious disease bill, which has elicited discordant voices from some Nigerians, as some see it more of extension of neocolonialism or outright cultural imperialism, while others see it as a product of the so-called development partners that often look into profit making than the general good and welfare of the third world citizens, in other words, developing countries. It should be noted that in an African state, when domesticating any treaty or enacting any law of the National Assembly, religious, cultural, political, and other factors such a system of government must be considered. If the bill goes through the proceedings of the National Assembly, it could metamorphose to become an act of the National Assembly. Thus, it is so sensitive that due consideration must be given to it so as to pass, among others, the following tests: national interest, legal status, and public interest. However, this very effort of coming together is very important. The bill attempted to illustrate a genuine interest in protecting citizens from falling prey to the menace of infectious disease that are likely to crop up in Nigeria or to gain access into the country by any of the ports through which goods and persons pass. It, however, contains some provisions that tend to grant excessive and arbitrary powers to the Director General, DG, of the Nigeria Center for Disease Control, NCDC, and the Minister in such a manner that the fundamental rights of citizens appear to be jettisoned. There should be no act of the National Assembly that should in any situation breach the guaranteed fundamental rights of its citizens. Section 1, subsection 3 of the Constitution of the Federal Republic of Nigeria is very clear on that act of the section of the act of that. There are sample of recommendations. Suffice to state some of our reservations, which were adequately highlighted on page 1 to 24 of the main submission we did. However, few would be cited. For example, under section 3, there is need for retention of section 8 of the Principal Act and many others. Similarly, under section 1, administration of this bill, a grave error has been made by the bill in its vesting of powers of administration of the bill, as I said earlier, to the DG, who is actually responsible not only to the minister, but also to the NCDC governing board. Lest we forget, have we ever cogitated why EFCC has always had hitches in carrying out its assignments? Obviously, it is because of the contradiction of power to the chair, not to the law. And that is why those who are smart amongst the allegedly corrupt resort to use the law to favor them, despite the fact that the public opinion courts often hold contrary views on many of such cases.
1 minute remaining.
We therefore call for thoughtful caution on this bill, as it is about health and well-being, which invariably is not being adequately provided by the government and has also exposed the gross inadequacy of it in the Nigerian state. Let me conclude, Mr. Chairman. There seem to be, well, Mr. Chairman, there are some sensitive issues which border on religion, which they must be really taken care of. And I think on the board of the NCDC, let there be the Veterinary Council of Nigeria, Medical Association of Nigeria, in the NCDC governing board, and this issue cannot be really emphasized. And then another issue, acting without warrant of effect, the enforcement of provision. Thank you, Mr. Chairman. Thank you. Our submission has already been passed. Thank you for the opportunity.
We refer to your memorandum in. Produce yourself and the organization you are representing quickly.
Okay.
Straight to your point.
Okay.
Because of time.
Mr. Chairman, my name is Angela Iyodunukwe, representing National Association of Catholic Lawyers. Please permit me to do amendment to a paper before you. Number 6 and 7 of our memo, we intend to say that section 63 of this bill, we tend to amend that the provision of it can form part of section 26 of NCDC Act. And number 6 has to do with section 4. The analysis is 4(6) to 62, 64 to 76, and 79. All these sections we intend to go under the section 25 of NCDC Act. Having said it, Mr. Chairman, I want to say that we thoroughly look at the bill, and we felt that, in our view, that is inappropriate and unnecessary, considering the fact that there is a 2018 Law Act, which is the NCDC Act, that has a provision, entire provision that we needed for what we intend to cover with the Infectious Disease Act. And I want to look at the section. We did it based on the bill versus the NCDC Act to really let us know that there is no need for this. And section 1 of the bill, for us, is inconsistent with section 5, because section 1 established the Director General. You can't put the power, the life of millions of Nigerians into one man's hand, Director General. He has a limitless power. He has a discretionary powers that you cannot control. We are human. They say power intoxicates. So we need to watch it out. Then section 2, that has to do with, that permitting appointment has been taken care of in section 10 and 12 of NCDC Act. In that section 10, provides for corporate offices of the geopolitical zones and in all the states of federation. So the provision of section 2 ordering the Director General to go and to appoint experts again is uncalled for us. And section 3, that deals with the powers of the President, is inconsistent. Is actually provided in section 305 of the Constitution. Every power of the President that he needs to be done under this emergency, that are well covered there. I want to say that most of these, the amendment I made before section 4(6) to 62, 64 to 76, and 79 of the bill can be taken care of under the provision of the section 25 of the bill of the NCDC Act that gives powers to the DG, to the body, to come up with regulations. All these things can come under the regulations, and it will be quite taken care of. And we look at section 77 of the bill that has to do with repealing the Quarantine Act. We are of the view that rather than coming up here, we can strengthen the NCDC Act that can come up under the NCDC Act, repealing the Quarantine Act. So we can amend, we are proposing amendment of NCDC Act to include that section 77 of the bill. And we'll look at we look at 78, section 78, that gives the president can come up, can appear, can amend the powers entrusted onto the president under this bill can be done by himself or through the minister. We said there is no need for that because the provision has been covered. And I want to conclude, basically, though we said section 80 and 81 is unnecessary, when you look at all these issues we've raised, there is no need for those interpretations. But I want to specify that regulation, everything that has to do with regulation that has to do with infringement of fundamental human rights should be taken care of by a special application by NCDC to the High Court. The provision of magistrate court in the bill is uncalled for. We are talking about the human right. The section 46 of the Constitution specifies that for a human right issue, it has to deal on it has to be a jurisdiction of the High Court. So the provision of magistrate court having a jurisdiction over all these provisions of bill is inappropriate. It is not right. High Court should have a jurisdiction over that. And we finally, Mr. Chairman, I want to strongly, on behalf of the association, we strongly recommend that all the provisions provided in this place, most especially those ones that are section 4, 6 to 62, 64, 76, and 79, be done under the regulation section 25 of the NCDC. Thank you, Mr. Chairman.
We'll look at your submission in the memorandum. Thank you very much. The last person we've called, please can you call so that we can call the next 6. Director General. Thank you.
Nigerian Veterinary Medical Association. Thank you very much, Mr. Chairman. I am Dr. Dang from the President of the Nigerian Veterinary Medical Association. Mr. Chairman, sir, thank you for the opportunity, all protocol duty observed. The Nigerian Veterinary Medical Association wants to highlight some issues with the infectious disease bill, sir. The Federal Department of Veterinary and Pest Control Services under the Federal Ministry of Agriculture has the mandate to control animal disease and pests, both domestic and wild in Nigeria, sir. This mandate, the department has discharged credibly. For example, they were able to eradicate rinde pest, also known as cattle plague, which was done under the Ministry of Agriculture Veterinary Department, sir. Well, it's surprising that the new infectious disease bill, sir, is trying to take the mandate away from the Ministry of Agriculture, away from the Federal Veterinary Department, under the purview of Nigerian Center for Disease Control, a parastatal in the Federal Ministry of Health. The association wishes to highlight some sections on the bill are as follows: Section 11, subsection 1, 2, and 3A, section 17, subsection 1A and B, section 20, section 39, section 61, and section 79. For example, Mr. Chairman, sir, section 11, subsection 1 says the Director General may, by written notice, order the destruction of any animal or disposal. Animals, sir. Destruction of animals, sir. The Director General is not a veterinarian, sir. He cannot determine whether an animal is carrying an infectious disease or not. That is the purview of the veterinarians. And I think the Animal Disease Control Act, the Veterinary Surgeons Act, the Agricultural Content Act give veterinarians that mandate to be able to secure the health and lives of Nigerians. Also, sir, according to the Center for Disease Control, it is estimated that 6 out of 10 known infectious diseases in humans are of animal origin. And the people at the CDC are not experts in animal diseases, sir. The veterinarians are the experts in animal diseases. We are the ones world over that are recognized to say whether an animal is diseased or not. So I think it's also infringing on the mandate of the veterinarians in the country, sir. Also, 3 out of every 4 new emerging and emerging diseases have animal origins. For example, the COVID-19 we are all hampering around all. It's believed to be of animal origin, as other coronavirus outbreaks that we had before, which were also of animal origins, which they are all under the purview of the veterinarians. So this section is listed by our submission of the Nigerian Veterinary Medical Association. We wish to kindly ask the House to remove them from this bill, and should the need arise for the two professionals to work together, the veterinarians and the human colleagues, in the spirit of One Health, which is the global norm, we'll be more than happy to oblige the House and work together with them. Finally, sir, we want to thank you, the House, and all members here, all presenters here present on issues of health. Thank you very much, sir.
Equity, international initiative. Yeah, no, wait, I'm going to call 6. Action group on free civil space. Catholic Women Organization of Nigeria. That's 3. And then Nigeria Agricultural Quarantine Service. Okay. And then Society for Environmental and Public Health of Nigeria. And then lastly, National Council of Women's Society. Society for Environmental and Public Health of Nigeria. So please, can we start with Equity International Initiative? Equity. Please, you come according to the way you are called so that we can first start this thing. Get your document ready so that we just... Yes, what is the issue?
Yes, Mr. Chairman. We were on that list, but our organization was not... Mr. Chairman, I just noticed our organization was omitted on the list. Hello? Hello? Yes, I just noticed we're omitted from the list. The list just mentioned now. Yes, we were not mentioned because you were saying...
No, if you are not there, you are supposed to be here tomorrow now. We have 2 batches.
Okay.
Yes.
Okay, let me call the name because it was omitted.
Yes,
I think it
but
was
if
omitted.
we are through with this and we try to look at the possibility of taking you today.
I didn't get you. It's Doctors Health Initiative, and it's supposed to be on the list. Doctors Health Initiative.
Please, we have already, we have list for tomorrow.
Okay.
It's now, so you wait.
Okay, I've seen it. I'm sorry. Sorry.
Okay. Respectfully, Mr. Chairman, I am Barrister Kelechi Anosike, representing Equity International Initiative. Mr. Chairman, my assignment here is just very simple. I'm here to review the obnoxious and anti-people provisions of the proposed bill, highlight the danger it portends, and also announce that if these provisions are not corrected or sent back for redrafting, that this bill is dead, and I've come to lay it to rest. Mr. Chairman, let me start with Section 70. Section 70 has conferred immunity on the DG, NCDC, the police officers, port health officers, and any authorized persons for any action they do or they fail to do in the execution of this bill. Mr. Chairman, what this portends, the danger here is you cannot sue them for any action they commit while in office, even the negligence of medical personnel. Mr. Chairman, immunity is now for sale. If any of you here wants to buy immunity, support this bill, then commit any action, then meet the DG and CDC, pay pay any fee. He will not say you are one of the authorized person. That in his opinion, he suspected as a breakout or an outbreak of infectious disease in a particular location, and that he authorized you to go there. So while on that mission, you committed that crime or that offense, then you are beyond liability. Nobody can charge you for anything. That's the danger of this. Immunity now is for sale in Nigeria. Mr. Chairman, even the president of the country does not have power to protect anybody from criminal persecution. The best that Nigeria can do is, if a criminal action has commenced, AG can discontinue. But we've given sweeping powers to the DG NCDC, where he can prevent any authorized person from answering any action or inaction or crime the person committed in course of execution of this bill. That's what we've done, Mr. Chairman. I'll go to the next section. Section 55 provides for state-sanctioned assault on journalists and whistleblowers. He has given the DG NCDC power, if he suspects that any journalist or whistleblower is going public with any information or embarrassing article or piece, to storm their premises, enter without search warrant. That's what we've done, Mr. Chairman. And that is why this bill must be jettisoned. This is against free press. This is against our whistleblowers policy. This is official thuggery that we're trying to sanction. Mr. Chairman, section 24 empowers the police officers to apprehend.
While respecting your decision, this is a honorable house. Please be mindful of your words.
Thank you, Mr. Chairman. Section 24 empowers the police officers.
Listen, it's the general. We've agreed in our rules of engagement that we are going to be civil and we are going to respect everybody's opinion. But it must also be selective in terms of the language you are going to use. We do not stop you from expressing your opinion, but that opinion must be done with respect to those who are listening to you. Please, thank you. We have 1 more minute.
It empowers the DG to prevent any kind of meeting whatsoever. And when you seize a property, there is no provision for compensation. This offends the Land Use Act of 1978, because in declaring a property isolation center is to be gazetted. So you've revoked the right of occupancy of the allotee, and there is no compensation provided. This should be looked into, Mr. Chairman. Finally, Mr. Chairman, there's a hunchback policy, the wrong way of doing the right thing. Is a bill right? Good. Is it timely? Fine. But it's the wrong time for it. We have our local peculiarities and experience gathered from NCDC in fighting this pandemic will enrich this bill. When the stakeholders are carried along. Thank you very much, Mr. Chairman. Power is transit. If we don't take time, this bill will hold all of us tomorrow. Thank you very much.
This is the next organization we have called Action Group on Free Civil Space. Your time starts.
Good afternoon, everyone. The Honorable Chairman, thank you for this opportunity. All protocols duly observed. Mr. Chairman, sir, with the action space on Action Group on Free Civic Space is represented by 93 non-profit organizations and civil society organizations, and our concerns are as follows. The repeal of the Quarantine Act and replacing it with the Control of Infectious Disease Bill 2020 is timely an imperative. However, we are suggesting that the best practices that exist should be considered. Number 2, numerous provisions of this bill infringe on the constitutional rights and freedoms of Nigerian citizens. Number 3, granting overreaching powers to health officials, disease control agencies, and law enforcement officers or the police to prevent and manage the outbreak of infectious disease infectious disease is worrying. I will refer to section 24 of the Act, which says enforcement or police officers may apprehend and take any person suffering from an infectious disease whom the officer finds on any street, public place, shop, or public transportation to a hospital. Now the question is, how will a police officer determine that a person is suffering from an infectious disease? It's not feasible. Is it by mere physical observation or based on sound medical diagnosis? So you can be arrested for merely looking sick, even if you are not. We have had several issues just with the current COVID-19 pandemic, where we saw various people who were harassed. In fact, the number of people who were killed during this period by police officers is said to be more than the number of people who were killed by COVID-19 pandemic. So these are things we need to look into. We need to look into the powers which are granted to these people. And our conclusions are as follows. Subjectively arrest without warrants, confiscate properties, and obtain information without any restraint. With this, we urge the Honorable House to look into the provision of this bill and make amendments where necessary. Thank you.
Presentation in 3 minutes. Nigeria Agricultural Quarantine Services. Control of Catholic Women Organization of Nigeria. Please, your time starts as soon as you get to the podium.
The co-chairman, members of the House, ladies and gentlemen, members of the press. I am Cecilia Waneka Okolo, the national president of the Catholic Women Organization Nigeria. Catholic Women Organization Nigeria is the umbrella organization of Catholic women in Nigeria, numbering over 15 million. We are aware of the public outcry that followed the announcement of this bill. We have submitted our own comprehensive memo, but I need to mention just a few things. As mothers, wives, women, and citizens of Nigeria, we are concerned and feel responsible and obliged to make our position on the said bill known. We are key stakeholders in matters pertaining to the health and well-being of the unborn children and for the whole of the family. We bear these children, we nurture them to adulthood. We also nurse them. We are caregivers. When they get ill at the end of the day, the buck stops at our door. That is why we are very concerned. Now, the Governors Forum, the Catholic Lawyers Association, and some others have talked copiously on the sections of the bill that need to be touched upon. But we need to mention that of the unborn, the one concerning the unborn. Now, the unborn, the section 17 of the Child's Rights Act gives the unborn all the protection it can get. And it also gives the unborn the right to sue anybody or persons who contributed to any illness or malformation that they may suffer later in life for having injections or vaccinations administered on them. The bill also contravenes Articles 4, 6, 7, 10, 11, 12, 14 of the African Charter on Human and People's Rights, which provides for the right to life, integrity of person, liberty, and security of persons. The bill also is in violation of human dignity, human rights, and fundamental freedom, which Article 3.1 of UNESCO Declaration on Bioethics and Human Rights uphold. We also hear that this bill is before the Senate, but titled National Health Emergency Bill 2020, and has passed the first reading and about to pass the second reading. Now, most Nigerians who oppose this bill believe that the vaccine is a lethal tool for genetic engineering and population control. Now, the Indian example is a case in point where publications in recent times have shown that various vaccines sponsored by WHO and Gates Foundation in some countries have been implicated in various health hazards to women and children. India is one of such countries where children who received polio vaccine ended up with vaccine-strained polio paralysis affecting 496,000 children. The human papilloma virus vaccines also developed side effects ranging from autoimmune disorder to infertility, while some died. This made the Indian government to send WHO packing. Now, we are asking the members of the House to please help us. That's our prayer, just two, actually. And they are that since this bill is in violation of the Constitution, they should please try and accept it, not just the Constitution, some other acts, and also international conventions and declarations ratified by Nigeria. They should please step down. They should rather concentrate on creating an enabling environment for our universities and research institutions to develop our own vaccines, which will be safe for our children and women. We must channel energies towards getting things right at home. We need to have water to wash our hands. COVID-19 tells us, wash your hands. That's one of the cardinal requirements of the federal government. But we don't even have the running water to wash our hands. We need to get all this done, all this in place. With the knowledge and awareness that God entrusts the human being to us women in a special way, we implore the honorable members to heed our request and the concerns of the Nigerian people and step down this bill for reconsideration. Thank you so much.
National Association of, which one? Okay, Koronto side, okay. It's National Association of Community Health Practitioners around Nigeria around. Okay, we'll come to you.
The Honourable Speaker, Mr. Chairman, sir, the NAQS appreciates the boldness and the purposeful concern to intervene at this time. And the public hearing is a determined effort to bring to bear that the best out of this bill will come to play. Therefore, permit us, the Nigeria Agricultural Quarantine Service, to make our highlights. First and foremost, Honourable Chairman, I want to draw the attention of the committee to the title of the bill. Already there's an existing Nigeria Agricultural Quarantine Service Act in place 2018, and therefore any other quarantine bill that we put in place should be distinctive, and we therefore suggest that it should bear the human quarantine in the nomenclature of the bill to distinguish it from the Nigeria Agricultural Quarantine Service because of the peculiarities of the functions the two agencies of government perform. Number two, sir, the proposed bill seeks to define health officers and other officers as mentioned. And in fact, other issues like cargo, merchandise, that are mentioned in the bill without clear-cut definition. We want to draw the attention of the Honorable Committee to see that these things are clearly defined, because in the bill, the head officers are said to be appointed by the Director General NCDC, and this provision goes contrary to all the relevant laws which regulate health practice in human, animals, and plants, because there are laws specifically for the medical health, veterinary health, or even the plant health, as the case may be. So the head officer should be qualified and defined. Number three, the issue of public health surveillance program. The epidemiological survey and investigation involve animals. And that has to take cognizance of the fact that those who are professionally qualified to handle animals, which is the veterinary profession, should be the ones in charge.
This is supported by Section 8.1 of NAQS Act and Section 7 of the Animal Disease Control Act of 1988. Number 3, the power of the DG NCDC to order to destroy and dispose animals without recourse to the veterinary profession or without recourse to the Honorable Minister, Federal Minister of Agriculture, who has the supervising authority over the Federal Minister of Agriculture. We suggest that this be looked into and corrected accordingly. Number 4, on the part of DG concerning port health officers regarding food and water, the provision goes contrary to international best practice and the mandate of NAQS in Section 6 and 8 of the NAQS Act 2018, the International Plant Protection Convention, who are directly in charge of plant and plant health matters, and for which Nigeria is a signatory to, and which is domiciled in the Nigeria Agricultural Quarantine Service. We would like to have the reconciliation of these facts so that there won't be contradiction in the bill as it is proposed. When we talk of issues of importance of vectors, there are some vectors that are relevant to the mandate of the NAQS and the Department of Veterinary and Pest Control Services in the Federal Ministry of Agriculture. It is our hope that the Honorable Committee will look at this, separate it accordingly, so that there won't be conflict of mandate and interest as the case is. Number 6, investigation of merchandise on board vessels. By the IPPC Convention to which Nigeria is a signatory to, the proposed bill in Section 40 did not distinguish or exempt goods, articles, merchandise, and baggage of agricultural quarantine importance. It is necessary that this is separated because the duty of inspection and certification, as the case may be, for agricultural produce by NAQS Act 2018 falls with the Nigeria Agricultural Quarantine Service. Dealing with outbreaks or suspected outbreaks in infectious diseases. This clearly applies to human quarantine, and since that is our first suggestion in the title of the bill, we pray that it should be reflected accordingly. Regulations. Section 80, subsection 2 of the NDDC Act as bill as presented, the powers of the Minister for Health to make regulations concerning animal quarantine stations, cleansing and fumigation of vessels.
Yes, we'll look at your submissions.
We draw the attention of that.
Your time is up. We are going to look at your
Thank you very much, Honorable Chairman.
Thank you, sir.
Good day. Honorable Chairman and members of the Federal House, ladies and gentlemen. I am Dr. Kachi Nwoga, medical doctor and public health physician, representing the Society for Environmental and Public Health of Nigeria. We have made a submission on this bill. We are happy to make a submission on this bill, listing so far about 32 points of interest that we believe will be very helpful to getting this bill to do what we believe is meant to do. And this is in tune with our communique of the 5th of April, in which we asked for, among other things, legislation to help the country in the 21st century to fight this kind of situation, health emergency. So we are pleased that the Federal House is responsibly responding to this health emergency today. We will highlight that our interests cover definition of terms. I don't have to repeat them one by one, because the loose definition of terms can actually cause more problem than it's meant to solve. And in this definition of terms, we also insist or advise or implore that the habit of building institutions should begin to come into all the laws that we make. For instance, if you replace the DG with the institution itself, which is NCDC, you actually solve a lot of the problems people are talking about here. Because inside the NCDC, you can now develop the rules of engagement, the rules guiding NCDC within that can help you to decide who does what within the NCDC and what clearances have to be got, even for the DG to be able to make certain pronouncements. So we believe that the building institution should be enshrined into this kind of thing we're doing by defining terms. When you define terms, it tells you who a health officer actually is. And I believe these are covered by the existing laws. And at the same time, the actions you're giving and strengths you're giving will not erode existing codes of practice. You can't, for instance, as a DG, decide and send somebody to become a health officer and you will go and start indulging in clinical practice when it's not licensed for clinical practice. So that is subject to the action that you are sending somebody to. Must be within the limits of the profession and the person is licensed. That's why we, for instance, suggested a language that said suitable registered medical officer / public health officer, environmental health practitioner, sanitary inspector or officer, superintendent professional to be a health officer. For instance, it's inside what we gave you. So a better definition does that. Second is this. There are protocols that should be used. We are particularly concerned with disease notification protocol, which is not properly covered in declaring a public health emergency. So we believe that, yes, we have a president who must respond when we have an emergency, and that's fine. But it should be by applying the disease notification protocols, which helps us to continue to strengthen our protocols and gives him a power to do so, not simply because somebody on social media has declared something has happened and he responds to it. No, it should follow. Without, in other words, after fulfilling or in satisfactory conditions of the disease notification protocols by the proper authorities, he can now declare. This will save us a lot because we don't know anybody. It's a democracy. We can vote and anybody can be. And any situation can arise. And before we know it, somebody has declared an emergency and an election is cancelled. So these are the things that we worry about. We are worried about the uncovered areas in the bill. And there are a number of them. In fact, we are sending you an updated version. We'll be sending an updated version of our observations. For instance, the use of electronics needs to be enshrined inside the law. You should be able to apply it. A part of the law says that you can get information. Now, today, a lot of information is moving more and more into the digital information. We're using electronic health record systems in many places. So you should be able to give that power now to be able to access electronic health records, to be able to get the information you need. And that even goes back to what I said, using disease management protocols. Because when you strengthen that, we also include electronic health records that can even give you alerts of something going on. Next is that the funding is not covered at all in this matter. And that's a very big lacuna because you can actually, we can decree any law and say everybody should get this should happen. How is it funded? How is the agency going to get money? And we think that this will best be done by involving the health insurance, since we have a target as getting universal coverage.
Thank you. Your
that we should.
The committee will look at your memorandum and fill in the gap that you have not reached yet.
Okay. So we also think that
your time off, sir. 5 minutes. So.
Okay. Thank you.
National Council of Women's Society. National Council of Women's Society.
Distinguished ladies and gentlemen, we bring you greetings from the House of Women, the apex organization that regulates both registered and passive members, women of Nigeria, with over 100 million membership strength across the state, local government, 774 local government, and the FCT. We are here because we are aware of the shock for the COVID-19. Nigerians reacted. This message is from the headquarters by Dr. Ambassador Gloria Larabasho Diamani. We have observed the bill in the National Assembly. The question we ask, why there is urgency to push this bill? Hence, we looked at the merit. The merit of this bill was to empower the NCDC for present and future preparation for other diseases and the current diseases. Again, we have discovered that this bill will be giving a lot of attention to NCDCs having the powers to penetrate homes. You will agree with me, in this pandemic, even when Mr. President and Commander-in-Chief of the Federal Republic of Nigeria was issuing a command, he said, and I quote, that food and palliatives should get to the households, because the households are the minute houses that houses Federal Republic of Nigeria. Nigerian women remain the heads of this household. Hence, we are calling on this committee that whatever action will be taken should anchor around women, because women remain the household's catalyst for any change and development to take place. You will agree with me again that this bill has exposed that we have deficiency in our health sector. When a woman is pregnant with COVID-19, when a woman is hit by the disease, it is not just a woman. It is a woman, and perhaps a pregnant woman, who is carrying 1 or 2 or 3 of babies within. Hence, we are saying that whenever NCDC or the responsive government or our legislators are talking about the worst hit and referring to women, they should give us index whether the woman was pregnant at the time of heat. The dismerit we will want to bring to the fore. The countries have prepared. They have made rules. They have made guidelines. They have made amendments. Nigeria will not be an exemption. NCWS will also add a voice. That part of the dismerit for this is too much powers given to NCDC to warrant NCDC and relevant authorities to have access without permission, without acceptance of our household. You will agree with me that it is that woman, that average Nigerian woman, that sits back and holds the children. When the man runs away, she gathers the 14 children, both her children and her maid's children and her husband's extended children within a household without a housing distancing. Hence the need for proper advocacy, sensitization in our local languages for an average Nigerian woman to understand what we are talking about in the health session and the COVID-19. It will be when they use too much force, infringement on the rights of that average Nigerian woman. You will agree with me again that in terms of sections, the section that talks about destruction of infected animals and humans, when the police came here and referred to humans, it is more of women, because women are in the informal sectors and petty traders. They are food vendors, they are petty traders. We are not too much empowered. We have brought bills of gender equity to the National Assembly. We did not see this zeal. We did not see this fire that the National Assembly is putting on this bill when gender equity is a global pandemic. It is a global virus in Nigeria. When we are talking about the health sector, of course we are going to improve in the next decade. Nigerian women should be considered in purchasing powers. For instance, if ambulances are going to be purchased, Nigerian women should be contacted. The Ministry of Health can form a committee of advisory. We want to see able, capable women in this committee. We will not fold our hands to watch Nigerian women being marginalized in a post-COVID-19. On this note, I rest my case to allow NCWS submit its memorandum to the committee. We thank you very much. I remain yours, Comrade Safia Ibrahim. As a comrade, I would rather suggest that whatever we have seen, it should be implemented on our representative first, than the people. Thank you.
We are going to call the next You have not submitted. Where is she? Okay. Okay, National Association of Community Health Practitioners of Nigeria. Dr. Mohammed Etudai, Society for Economic Right and Accountability Project, Society for Economic Rights and Accountability Project, Nigeria Association of Public Health Physicians of Nigeria, and Society of Public Health Professionals of Nigeria. Please.
Mr. Chairman and others, I'm Dr. Ibama Asutan Solomon, representing on behalf of National Association of Community Health Practitioners of Nigeria. Community health practitioners are frontline primary health care professionals that are practicing in over 20,000 primary health facilities in Nigeria. Their practices being regulated by the law of the Federation of Nigeria, Cap 19, 2004, via the Community Health Practitioner Regulation Board of Nigeria. They are trained clinical experts of the primary health care institution. Mr. Chairman, you will recall that in Nigerian health system, primary health facilities are mainly sited in the rural communities, while general and teaching hospitals are sited in urban and city communities because of the basic requirement and condition of operations. It is also known all over that vaccination is the most cost-effective preventive measures in the control of infectious diseases of whatever degree of infectivity. It is also known that vaccination is basically a clinical service delivery obligation of the primary health care institutions in Nigerian health system, with policy trust strategies, including health facility-based, community-based, home and mobile vaccinations. It is equally known that the major healthcare professionals engaged in such vaccination services to the population equitably are the community health practitioners. But it was observed that these very important clinical experts of the primary care facilities operations are visibly omitted in the proposed infectious control bill, knowing that vaccination is the most cost-effective measure of controlling infectious diseases anywhere in the world. In this light, we have put up areas that need to be considered as to be including these very important clinical experts if we have to go a headway and on to ensure that we achieve in this bill after all being said and done. So in the areas of part 2 that has to do with section 4.1, we have made our own contributions as to be reviewed to including community health practitioners in that section. In the area of surveillance and contact tracing measures at premises that has to be reflected in section 19.1, we have also said because the community health practitioners are always, today even if you go into the communities, they have prescribed time of rendering their services from 80% every day, 80%, 50%, 20% of these clinical experts render their services in the community, going to the household levels, and that is the strength of these primary healthcare professionals, and so they need to be also visibly reflected in that section. As well as in part 4, vaccination and other prophylaxis. So we have also reflected in that section 49.1 as for the committee and all other protocols to do needful to be including these community health practitioners. And we have also gone to certificates of fitness that has to be reflected in section 51.1 that need also to be revealed to consider this group of clinical experts of the primary care settings. We have also gone down there from up to subsection 3 and 4 that need this review to be reflected in our considerations. Fees for vaccination and other prophylaxis that has to do with section 54, we have also put in our input to be considered by the committees and all. whatnot. We have also talked about the regulation policies and the laws that is reflected in Section 80 in subsection 1 and F that has to do that. And in the interpretation, the community who are community practitioners should be clearly defined as interpreted in this very important act to be enacted. Thank you, and God bless.
Five minutes, and your time starts as soon as you are on the podium. Please.
Thank you, Mr. Chairman, co-chairman and members of this distinguished committee. Let me say that you have presented me with the most difficult work here because my memorandum runs into 38 pages. So I'm going to quickly make 4 or 5 key points. The first one, sir, is with respect to the issue of arrest without warrant. There has been a lot of complaints about arrest without warrant and its predominant use in the bill. But with respect to contextualize that, under the Nigerian Constitution, you may derogate from the rights of a citizen, isn't it? Section 35, subsection 1 of the Constitution. You may derogate from the rights of a citizen by a procedure permitted by law. The Constitution does not make a distinction between arrest without warrant or arrest with warrant and so on and so forth. By a procedure permitted by law. So it is the law that determines the procedure by which the state may derogate from the rights of an individual. That is the first point I want to make. And then to say that this mechanism of arrest without warrant has been with us all our lives. Under the Criminal Procedure Code, under what's the name of the Criminal Procedure Act, arrest without warrant is the rule. Arrest with warrant is actually the exception to the rule. And so if you look at section 18, for instance, subsection 1, A to L of the Administrative Criminal Justice Act, you will find 12 instances in which a person may arrest, in which the police may arrest without warrant. And then finds under sections 20, 21, and 22 that private citizens may also arrest without warrant and then hand the suspect over to the police. I think this should take care. The idea of arrest without warrant is actually liberalized. It's not as stringent as most people think it is. That is the first one. The second issue is this temporary taking over of property and so on and so forth also, which I know has also caused a lot of controversy. Again, I urge us to look at section 44, subsection 2F of the Constitution. It is, let me make the point, sir. If it is a question of temporary takeover, then it is permissible by section 44, subsection 2F of the Constitution. With respect to apprehension of persons in public places suffering from infectious diseases, again, this has caused a lot of controversy. But again, let me stress that it is actually analogous to the situation under section 18, subsection 1 of the Administration of Criminal Justice Act, where you may arrest someone who is in the process of committing a crime or someone you have reasonably suspected of having committed a crime. And so the point I'm making is, if there is someone, for instance, who has visible signs that he's suffering from COVID-19, for instance, also, health officials and the police should be in a position to arrest him without warrant because of the communal interest. So this one is not in doubt. It has been in our law from time immemorial with respect. So That is that there is the issue of prohibition of restriction of meetings, gatherings, and public entertainment. This one has also been a matter of controversy. But again, under section 45, subsection 1A and B of the Nigerian Constitution, it's the right to movement, to freedom of movement, etc., are some of the rights that the state may derogate from on account of public health and so on. Let me make the distinction, because it may sound harsh the way I have put it, but that is the truth. There is a difference between the law that is and the law that ought to be. And most of us walk around in our heads with the law that ought to be. But there is a difference between the law that is. But I have given you exactly what the Constitution says about some of these issues. Okay. Sorry?
But then start as soon as you get to the podium.
Yeah? Okay. My name is Atinuke Adejuyigbe. I work with Socio-Economic Rights and Accountability Project, SERA. Basically, SERA proposes this bill in its entirety for the following reasons, among others. 1, the bill violates the right to private and family life. Section 8 of the bill does not take cognizance of the rules guiding doctor-patient confidentiality. Then sections 10, 11, 12, 17, 54 of the bill offends the right to fair hearing and private life. The bill violates procedure on compulsory acquisition of property, allowing destructions of buildings and turning buildings to isolation centers as provided for by section 15 sub 1 of the bill. Sections 46 and 47 of the bill provides for compulsory vaccination. SERAP sees this as a breach of rights to health and human dignity. Then our recommendation at SERAP recommends that the bill be immediately dropped as it is not in tandem with the various fundamental rights guaranteed by Nigerian Constitution and Nigerian international human rights obligations and commitments. SERAP also recommends that the National Health Act 2014 suffices as a better alternative to the Control of Infectious Disease Bill and National Center for Disease Control Acts. What are we saying at SERAP is that the National Health Act 2014, if given necessary amendments to address the current deplorable state of our health system and respond to health emergency, we equally recommend that the National Health Act 2014 be strengthened and implemented by adequate funding to take care of our primary health care concerns. I think we are done with that. Thank you. I will be very submitted our amendment.
Please. Sure. Association of Public Health Physicians. Please, I've called you in that order. Please quickly come forward so that we can save time.
Good afternoon, Mr. Chairman and the House. My name is Dr. Dan Gadzama. I represent Association of Public Health Physicians of Nigeria. Mr. Chairman, the association is very happy with the draft of the bill, and we have made a painstaking review and have submitted our observations. I shall, however, go through a few of those observations. Mr. Chairman, let me start with the title. And the title says, Control of Infectious Disease Bill. We feel it is not encompassing as the scope is narrow. You know, if we look at the International Health Regulation of 2005, we therefore suggest that the bill should be Public Health Emergency Bill, and the definition of public health event should be captured in the bill. And then I move to Part 1, under administration. Now Part 1, Section 8, Subsection A. It states, and I quote, any healthcare professional to obtain from his patient such information as the Director General may reasonably require for the purpose of transmit such information to the DG. This, we feel, contradicts the rights of the patient according to the National Health Act of 2014 and should therefore be expunged. It also says that the Director General, a health officer, or a police officer may, without warrant and with such force as may be necessary, enter the premises. This, we also believe, violates the fundamental right of our citizens, as contained in Chapter 4 of the Constitution. Now, Part 2, Section 4. It says, and I quote, notification of an infectious disease by healthcare workers to the DG NCDC. Now, it is noted that the notification of public health events is under concurrent list, and therefore it should be done through the integrated surveillance reporting system, which emanates from the community, the area council, the state, and then to the national. Then Section 5, under Part 2, Section 5, Subsection 1. The DG to initiate surveillance activities, the same thing. Surveillance is, we should follow the protocol, the IDSR 2013 protocol, which is clearly stated. Part 3 of the review, prevention of international spread of infectious disease. In Section 27 to 45, DG or Port Health Officer to administer a mentioned in many places. However, the matters here fall under the Port Health Services. So what the DG NCDC does not have relevance here when you look at the Port Health Act. And then we look at vaccination and other prophylaxis. A section should be included to lend more thrust to the bill. It should contain the title, List of Diseases Requiring Vaccination and their respective vaccines. And a list of diseases requiring vaccination and their respective vaccines shall be produced by expert committee as constituted and empowered by the minister. Section 46. Okay, so Mr. Chairman, we feel that this bill needs robust and further review in order to consider all the issues that have been raised by various speakers and by this great association. Thank you very much.
Thank you.
Thank you very much, Mr. Chairman, Honorable Chairman, and other honorable members of the committee. We appreciate this invitation. We have worked with the National Assembly in the past on several bills, and we are prepared to continue to deploy our vast reservoir of expertise to continue to work with this noble House. With regard to, as the foremost health professional group in this country, Society of Public Health Professionals of Nigeria, we welcome this bill, but we have strong reservations as to its necessity. We want to proceed, Honorable Chairman, that in the modern world of today, and according to best practices, and especially environmental health and services and legislation, and the responsible officers should be organized in 4 strata as follows. 1, In the area of personal, domestic, and commercial environmental hygiene and health services, the authority should be domiciled in the local government areas and at the primary care level under the medical officer of health and the health inspectors working with him. Section number 2, industrial and occupational health, environmental health laws and their enforcement should be domiciled in the National Ministries of Labor, Factory Inspectorate Division under the Medical Inspector of Factories. Number 3, with relation to international port hygiene and environmental health services, their laws and enforcement should be domiciled in the Directorate of International and Port Health Services. Mr. Chairman, next we believe that we need to consider the nature of what should be the nature of national centers for disease control. According to modern best practices, centers for disease control and prevention in the modern world are established as the apex centers for the assistance, as the emphasis, assistance of levels of national, regional, state, and local governments, where and when emergencies occur in those places, at those levels, in order to deal with the diseases that come up, especially of an accidental or disaster or epidemic nature. Such levels announced of the government are usually the ones that have routine and ordinary legal responsibilities and rights to enforce any of the public health laws under their circumstances. We want to add that in the present circumstances, what should we do? The government should make provisions rather than laws. Provisions rather than laws to make the Nigerian NCDC capable of responding properly and adequately to invitations to that organization for assistance by other levels of government for medical and health emergencies, whether of any new and emerging or emerging infectious diseases, of any other medical and health emergencies in the country. The agency, NCDC, or its Director General, must have nothing to do with health laws or their enforcement in Nigeria, but only to render medical and health services assistance, as the case may be, to other levels of government. We therefore recommend the following measures. 1, the creation of the Office of the Surgeon General in the face of having adopted a presidential system of government. Number 2, we should make progress with the universalization and strengthening of the offices of the medical officers of health in all local governments in the country and other federating units, else that the country should develop a genuine federating nationhood. Number 3, the other existing and properly functioning public health services, legislation and enforcement agencies and units should be strengthened, as due especially at the federal government level, that is the international port health services, industrial and occupational environmental health services in the Ministry of Labor, and the new development environmental health services as best determined by indigenous experts. And lastly, the creation of a National Institute of Occupational Health and Safety, independent of the Federal Ministry of Health and Labor, either independently or part of the National Institute of Health, to take responsibility for utmost occupational and industrial health emergencies beyond what the present Ministry of Health and Labor are able to do. Thank you very much, sir.
Doctors' Health Initiative. I don't know, wait, just wait. Happy Home Foundation. Association of Catholic Medical Practitioners of Nigeria. Foundation of African Cultural Heritage. National Islamic Center, Zaria. Please, okay, we can start with you.
Okay. Respectfully, Mr. Chairman, good evening, everybody. My name is Uko, Barrister Uko Francis Nnamdi. I represent Doctors' Health Initiative and Foundation for African Cultural Heritage. We have submitted our memoranda on these, the above mentioned organizations, but...
So you are representing two organizations?
Yes, yes,
Okay.
yes, Mr. Chairman. Doctors Health Initiative and Foundation for African Cultural Heritage.
Okay.
We'll filed our memoranda, but I won't waste the time of this honorable house. I will just go straight to the point.
Okay.
And this bill is sudden, it is speedy, it will lead to abuse of power if it is allowed to go this way. So we thank you for this forum because it has afforded opportunity to brainstorm, and it is our wish that whatever we say here will be put into cognizance. As lawyer and as a practicing lawyer, I know, like from law school, they tell you if there's a draft of any document, you show it to at least 2 lawyers. And for this committee, they should be able to make these documents get to other lawyers outside this committee. At least they should have their own input. That is so that. And I also feel in contacting in times of diseases like this or infections, there are likelihood of mistakes. There are likelihood of mistake if you don't wait over a time, because now there are certain things, there are things that are ongoing by NDC, NCDC. We need to know how they tackle some of these infections to also contribute to the laws we are trying to make. So I think this law is speedy, we can be a little slow about it. That's what I feel. Then in approaching people, the society, to push away apprehension, I feel there should be a team of medical and legal team to ensure people's rights are protected, and to also ensure that consents are necessary. Consent is necessary in the field of medicine, that those things are adequately gotten. Otherwise, we'll find ourselves with one or more litigation. So I will point on some of the sections in the proposed bill. One is the apprehension of persons on the streets suffering from infectious disease. I feel that it is our position that is too broad. What about those with mild infection? This should be considered. Then we'll look at section 25 again, power of enforcement officers to order destruction of house, building, or anything. There's room for disinfection rather than destroying a building. What if it is a school that is particularly useful to the society? Will you destroy it? This should also be put into consideration. Then section 47, responsibility of parents, particularly vaccination of children. We must place a caveat on this. We must be careful. We must consult medical personnel on this. Vaccinating children immediately are giving birth to, we must redraft this part of the section. We must invite stakeholders to look at this and create a caveat on this too. Then section 48, power to order certain persons to undergo vaccination or other prophylaxis. This is an infringement of personal rights or personal freedom of Nigerians. How do you prove, for instance, that a certain population has been vaccinated? This must be considered. Then another section again is section 51, certificate of unfitness. I feel generally, and it is a position of the persons I'm representing here, that there should be alternative. They must also consider persons with disability, persons that cannot air their views. I feel, in conclusion, that too much power is given to the DG. It should be considered. It is my wish and our wish that this bill should be reconsidered. Thank you.
Yeah, I'm representing Association of Catholic Medical Practitioners of Nigeria and Catholic Medical Practitioners of Nigeria and Happy Home Foundation Enugu. Good evening, ladies and gentlemen. Good afternoon, Mr. Chairman, ladies and gentlemen. As I have said, I'm representing two organizations, the Association of Catholic Medical Practitioners of Nigeria, and Happy Home Foundation. My name is Dr. Emmanuel Okechukwu. I'm a public health physician, and I'm the president of the Association of Catholic Medical Practitioners of Nigeria. The association is an umbrella organization of all Catholic medical doctors in Nigeria. We are delighted to be part of this public hearing, and as medical practitioners, we are obliged to make an informed evaluation of the bill to be known to the honorable member, so that in couching the final document, it has to reflect the realities of our time, the sensibilities of our people, and the needs of our nation, as well as their national security. We cannot accept that laws will be made that will infringe on the fundamental human rights of our people, duplicate the existing laws, contradict those that are in the Constitution, and jeopardize the common good of the people. We therefore think that, for instance, the aspect that gives Section 47 of the bill that empowers the others and other certain persons to undergo vaccinations or other prophylaxis rests with the Director General to mandate someone to be vaccinated, infringes, it lacks the respect for human rights, dignity of people, fundamental freedoms, informed consent, and other things provided by articles of the UNESCO Declaration, United Nations Human Rights. Section 48 and 49 continues with investing all the powers to other persons to undergo vaccination or prophylaxis in the Director General. This way, it paves the way for arbitrariness and totalitarian abuse of power for vaccination, to the widest extent that it is unconstitutional and against the provisions of relevant international documents. The bill is null and void and of no effect whatsoever. I just wanted to say that, given the proceedings of this day's event, honorable members, we would like you to look again at the process of lawmaking. Those who conceptualize the laws should necessarily approach the professional bodies Nigeria have. This country is equipped with professionals of different variables. Let them be contacted, consulted, so that the outcome of a legislative pieces should reflect what the reality of our time is. It is important, therefore, that all ethical issues raised here with respect to the mandatory administration of vaccine and prophylaxis be examined with due respect to, one, dignity of the human person, human rights, and fundamental freedoms. Their effects on the future generations, recognizing that the present generation owes a duty of responsibility to the future generations to come. Finally, the Association of Catholic Medical Practitioners of Nigeria firmly state that Nigeria has sufficient laws and policy frameworks to manage the epidemics and pandemics. Accordingly, we will strongly advise the honorable members to reject this bill in its current form, as it duplicates existing laws, and in addition, it tramples on the fundamental human rights of Nigerians, thereby running counterproductive to the Constitution of the Federal Republic of Nigeria. So we submit. Thank you very much.
Say, please go and present your decision.
Honorable Chairman, sir, other co-members of the committee.
Just a minute.
Thank you very much, Mr. Chairman. Deputy, observing all due protocols. I listened with interest, sir, and I so much enjoy your presentation. But towards the tail end, because as legislators, we like to be properly guided. You said there are some laws, there are some existing laws, okay? And I don't know if you are already equipped with such laws so that we can have this as part of what we have told this gathering here. Thank you very much, sir. Mr. Chairman, sir. Yeah, thank you, Honorable Member. There are a number of them, as have been mentioned during the procedure. The Quarantine Act is there. The NCDC Act of 2018 is there. A number of them. And if you want more, we can submit that effectively. It's to help the committee see what are already available. We can invent the wheel. In the process, a lot of avoidable mistakes are made. We look at what are there, upgrade them. That's what we are suggesting.
Thank you. Yes, please, can you start?
Okay.
Yeah. Thank you.
Honorable Chairman, other members of the committee, my fellow stakeholders, I stand to represent the National Islamic Council, National Islamic Centers area. I am by name Salisu Akaki Musa. Mr. Chairman, sir, we from the NIC, that is National Islamic Center, hereby wish to make the following submission. First, we thank the National Assembly for inviting us to make this contribution at this material time, which is really timely. Secondly, we commend the effort of also the National Assembly, specifically this committee, for making this move at a current time like this. Mr. Chairman, sir, it is a known fact that Nigeria is a religious nation. Therefore, we need to give religion consideration in our policy. To be, we emphasize as follows. Our major concern regarding this bill revolve around the following issues. 1, involvement of NCDC in place of worship. 2, works and disposals of corpses as contained in section 12. 3, vaccination and other professions as also contained, that is vaccination, as also contained in section 30 and section 48. Involvement of NDC in place of worship. It should be noted that religious affairs are as professional as a religious body. Works and disposal of corpses as contained in section 12. Islam has specific instruction regarding the subject matter under reference, which it may, in many cases, do not conflict with the valid scientific regulation, but with additional requirement to many scientific measures. To this end, NCDC and any other authority, government agent, should act in full consultation with appropriate Islamic authority where the corpse of a Muslim is affected. Vaccination and other vaccination. Our principal concern here is the area of testing vaccine on human. The unfortunate incidents of testing vaccine on innocent Nigerian children, which led to the premature death and incapacitations of many children about 3 decades ago, is still fresh in our mind. So, we strongly object to making Nigerian tool for experiments. Government must ensure the safety of vaccine before administering them to Nigerians and should take full responsibility of extra side effects. Thank you for giving us this opportunity.
Thank you.
Thank you, sir.
Yes. So I think we are progressing. Yes, you can talk. Please, the Deputy Chairman want to make observation.
Thank you very much. This last speaker, they were making examples of vaccines that were administered 3 decades ago. That was actually a drug, not a vaccine. I just want to correct that. It was a drug. It wasn't the vaccine. So we should state the correct things here so that we don't misinform people. That's just what I want to observe. Thank you.
But I think so many issues have been highlighted. If areas that you think you want to shed more light has not been highlighted, please, you can take more time to dwell on those areas so that we cannot be repeating one thing and the other. That's just the observation so that we can. No, sir, Military Council of Nigeria. No, see that I'm going to call this thing. Alliance for Surviving COVID-19 and Beyond. Christian Lawyers Fellowship of Nigeria. Environmental Health Regulation. Where is it now? Environmental Health Regulation. Coalition of Civil Society for Citizen Action Against COVID-19. Okay. Please, and then Nigerian okay, so please can we just have a call? Can you please start coming? We're almost on.
Thank you very much, the Chairman. We want to appreciate the painstaking effort that has been put into drafting of this bill, and to point out that Part 2, Section 4 of the bill need to be expanded so that the notification of disease can flow from the community up. Flowing from the community will ensure that the local government authorities are notified, the states are notified, and the NCDC is notified. So when that is done, it will help in statistical computation and quick response. This will actually help the protection of health officers who are practicing at the community. It will help also in limiting spread, community spread. And I'm very happy that some other presenters have pointed these issues out even during the course of the discussion today. So we're looking at that Section 1, Part 2, Section 4, subsection 1, 2, and 3. Either it's authorized rightly that a medical practitioner should notify, and every person in charge of a laboratory tool should use for diagnosis should notify. But that we feel that is not enough. It needs to be expanded because currently we have the 3 tiers, as we know: primary, secondary, tertiary. This would have been enough if we're looking at only the tertiary and the secondary health facilities, but whether public or private. But by so leaving it like this, it has left the primary health care level out of it, because it is only the comprehensive health centers that usually have medical practitioners. All our primary healthcare facilities, most of them in all the 774 local governments, do not have medical practitioners there. So what happens to those centers? Because they are the ones attending to patients, and a lot of them. So we feel that that part should be expanded to include the practitioners, the professionals, or healthcare providers, whatever name that can be used to capture it well, who are practicing there and caring for patients and having reasonable suspicion that this may be an infection for notification. So from that level, that information can get to the local government that usually have medical practitioners or officers of health, and then to the state too, while the national is notified. That will allow for quick response, even at the local government. It would allow for quick computation of statistics and follow-up. So it is based on this that we please request that part 2, section 4, subsection 1, should be expanded to include the nurses, midwives, community practitioners, health practitioners who are working at that level. The most senior should report or notify, and the notification should also reach the local government as well as the state, while the NCDC is also notified. We look at the clause, a prescribed class in section 4, subsection 3. These need to be properly defined for clarity to ensure that those given the responsibility of reporting infectious diseases are not left in doubt. So that clause there is a bit ambiguous, and it doesn't clearly state who is this person in a prescribed class. So we feel that examples should be given, and so that those who are involved will be able to notify appropriately. We feel that if this section is looked into, it will allow for a holistic notification of diseases from the grassroots, so that the primary health care center is not left out. Thank you very much.
National Medical Free Council of Nigeria. Yes. Alliance on Surviving COVID-19 and Beyond. ASCAP. ASCAP. Okay, ASCAP. Okay. Which one? Which one is number 8? I'll call him. ASCAP, what else? Christian Life Fellowship of Nigeria. Which one? 8. Okay. No, you came in late. It wasn't.
Thank you, Mr. Chairman. My name is P. Daffy Esquire. I stand on the pedestal of Christian Lawyers Fellowship of Nigeria. Mr. Chairman, our memorandum was submitted on the 3rd day of June and was duly acknowledged by 324 on the 6th day of June 2020. We seek to adopt this as our position and urge you to hold on to the submissions and pay very close attention to this memorandum particularly. The one that I've just adopted.
What of the one previously?
The one we have submitted is what I've adopted.
Okay.
As our submission, as our...
Okay.
Yes. Mr. Chairman, legislation thrives best on policy. For legislation to be successive and successful and sustainable, there ought to be a policy first. As a forerunner, we therefore submit that we should go back to the drawing board and adopt a policy, push the policy for a while, and have a sustainable legislation everywhere the world over. Policy comes before legislation. We urge you to consider that as our posture. 2 things we seek to do now: identifying objectable provisions of this bill which are in conflict expressly with the Constitution of the Federal Republic of Nigeria. The first thing we want to confront in the bill is that this National Assembly, very honestly, lacks legislative competence to deliberate on this bill. Why? Because...
Withdraw that statement. That is our primary work. Please withdraw that association. Competent will do that. Come here. Yes. We are out now. We are bringing out of order. So please, can you, we have pleaded that we're going to be modest in our language. You cannot...
I apologize.
No, you cannot go and stand in the sun, in the rain, to vote for your representative, calling us here that we are not legitimately, we are not this.
I was going
So
to, I was going to say I apologize.
Sir, I think that is beyond this. We have ruled you
officers. That's where you see the environmental health officers. That's where you see the medical officer. That's where you see the chief medical officer, and so on and so forth. So a look at those documents may be very useful. And other ones have been said, like this function, some of the functions to a health officer is statutory. In most of these laws we've mentioned, like arrest without warrant and all those things. I think if we look at those laws, it will help us to get a better and cleaner and more sustainable act when it is passed. I thank you, and don't relent. God will continue to bless you. Thank you. Thank you.
IT for student action against COVID-19.
Good afternoon, everybody. At this point, I want to appreciate the committee and the chairman and the co-chairman for seeing this bill as very important to the national life. I remember I almost have Ambassador Agbon Splendor, the executive director and national coordinator, Coalition of Civil Society for Citizens Action Against COVID-19. Our memorandum is already submitted to the committee. I will just read very briefly and highlight some of the areas that needed to be strengthened in the bill. We bring you greetings from the Coalition of Civil Society Action Against COVID-19 today. We are happy to be sharing ideas and recommendations on the enactment of this very all-important bill. Our recommendations. The entire focus of the current bill is more on prevention and containment and less of detection. Without having a shared responsibility in detection, how can we then stimulate citizens' actions to stop the spread of an outbreak? Under the powers of the Director General in controlling spread of infectious diseases within Nigeria, the onus should be on immediate process for action on detection of an outbreak in many communities in Nigeria. This is certain in a country where there is vast disparity between the citizens living in the urban areas and those living in the rural areas. Most outbreak diseases such as Lassa, fever, polio, chickenpox, malaria, etc. are considered as household ailments and that are acceptable as a normal health issues in the neighborhood. And these are epidemics in Nigeria. There must be an obligation for people to take responsibility, and the structure to achieve this is in the local government area. We are therefore proposed that the bill should also decentralize the powers that strengthen the detection process by giving responsibility to the local government health coordinators, who is normally a senior local government officer, a medical officer, to initiate a process of detecting an infectious disease in the community and local government. In the case of a community outbreak, our measure be of an infectious diseases, the primary health coordinator of a local government area shall inform the Director General of the NCDC within 24 hours of an outbreak or strange infectious symptoms observing area. We can see our gun present here, and we believe they should have role to play. As the local government chairman, he is the chief security and the health officer of the local government. By this information of detection of an outbreak and symptom initiated by local government's primary health coordinator, the local government chairman shall cause an investigation on the information and take proper measure within the law to contain the spread of the infectious disease in the country. The local government must take responsibility in an event of an outbreak. We advocate that this bill should make provisions for shared responsibilities in leadership rather than absolute power.
One more minute.
An individual.
One more minute.
If an individual must assume the power, he or she must be guided by processes which originate from the federal structure. Local government communities levels are still the sure level to fight any pandemic or epidemic in Nigeria. The experiences are observing that the COVID-19 pandemic is obvious for one to deduce that stopping community transmission can not be handled at the federal level. So making a powerful director general without corresponding responsibilities and specific roles being played by other key stakeholders in the state, local governments is like going to the battle without having the background knowledge of the enemy. It therefore means that we are just going to be fighting an outbreak without really putting solid, practicable measures in stopping it. It is important that House of Representatives should show leadership and begin to correct the dysfunctional aspect of our federalism by giving more responsibility to states and local government. On this note, I want to submit that the bill should be looked into very thoroughly, not to be passed in a hurry, not to further cause disaffection amongst Nigerians who is only seen being disenfranchised in the bill. I want to appreciate the committee, and God bless you as you continue to do your work. We will support you in your engagement. Thank you.
Listen. No, I'm calling you. Just sit down, take your seat. Medical Laboratory Council of Nigeria. That's good. Shippers Council of Nigeria. National Initiative for Legislative Studies, News. National Institute of Legislative Studies. Are they around? National Institute. Nigerian Infectious Disease Society. Nigerian Institute of Science Laboratory Technology. Association of Science Laboratory Technologies of Nigeria. Okay, so this is the last. Once we take over those, okay, only two. So those that we have called plus the two are the ones that we are going to take.
Okay, sir, with all sense of humility, I came here when they were cleaning this hall.
Okay.
As the first person.
Okay.
And I represent a critical stakeholder in the health sector.
Yes.
The Association of Medical Laboratory Scientists of Nigeria. And you had called every person here.
You said?
Yes. I said every person in the hall had been called. Even those I came before. In the list you have, or the list sent to me, our association is number 7.
Number?
7. And I have stayed all through till now. I have a live program on COVID updating channels, and I am still here.
Please, let me accept whole responsibility. The mistake is from us. The list I have here, number 7 was not ticked. You understand? No, I say I take the whole responsibility. Please accept the apology. Eh? Yes. Yes. It wasn't done in anything. Please understand it's not intentional. It wasn't marked, please. And I'm responsible for all that happened, and please accept my sincere apology. Thank you, sir.
Mr. Chairman, other members of this honorable committee, my name is Dr. Kashmir Ifeanyi. I am the spokesperson for the Association of Medical Laboratory Scientists of Nigeria. We adopt our submission as written and already submitted to the committee. For us, the question is whether there's a need for a legislation. And we have a two-pronged answer of yes and no. No, because we have extant legislations amply that we can activate to deal with the situation. Yes, because we need a legislation that must stem from our experience with the current pandemic going forward. We have a synopsis in our submission, and we have raised observations and recommendations in the following parts. Part 1 is overflogged. I wouldn't dwell much on it, but I want to inform the House that presently the position of the DG NCDC is a sole administrator position. We are very lucky that we have a rounded person in that office today because the act is not fully operationalized. We will require to have a board, a governing board, and the Health Advisory Council. All these are not there. And people worry if this legislation will further strengthen the oligarchy of the position of the DG. Now, that is about that. The next thing that begs for big answer is who is a health officer? In our establishment, design and development, it's alien. Somebody has cited the defunct Western Region law. It is defunct. And so in our current establishment, design and development, no health officer. Therefore, we need to define who is a health officer, and we have a submission as to who should be a health officer. A healthcare professional with not less than 15 years post-qualification experience with ample integrity from any of the regulated professions in the health sector can be appointed a health officer. The other aspect is the issue of the medical practitioner to report. Today, in a dynamic healthcare system, it's no longer the medical practitioner as per those regulated by Medical and Dental Council Act of Nigeria that see patients. That is the practice. So we have recommended also that for that section, the word healthcare practitioner or healthcare provider as submitted by optometric dispensary register can suffice. Again is the issue of the officer in charge of a laboratory to report. Our worry with that is that it will engender injustice. I'm a very senior person in medical laboratory practice. Most times I do not have the duty of going to repeat what my professional colleagues have done or verifying that they have done it. And therefore, in medical practice, it is a professional practice and individual practice. So the individual who performs the test should be responsible. That is, the medical laboratory scientist who performs the test should be responsible for the reporting. The other thing that is important is this. In this country, we have had a quagmire that is not necessary. And that is because of the misconstrue of the word clinical laboratory. If you look at ISO 15189, that is the international standard for medical laboratory practice, what is specific for is for medical laboratory. And we're of the opinion that everywhere for this diagnosis of human disease appears in this bill, the term either clinical or laboratory should be modified and to be rendered as medical laboratory. The other issue is, if we look at section 60, the definition for who is a healthcare provider is missing in this law. Now for us, what we want to suggest to the House is to do one of
one more minute.
Yes, I will do that in the 1 more minute. The House can pass this bill as a standalone act. If all this is to be performed by the DG and CDC, the House should rather consider an amendment of the NCDC Act to warehouse this. Now, again, is that the House says this will repeal the Quarantine Act. The provisions of this bill is insufficient to repeal the Quarantine Act. I will say this because of this. This law never made provision to counter terrorism. I am a trained counter-terrorism expert. I trained in 2 countries, Nigeria and in Cairo, Egypt. Now, this law never made any provision for bioterrorism. This law never made any provision for import permit. I'm a researcher. I had imported biological into Nigeria. This law never made any provision for import permit for those of us that play around with biologicals, with live organisms, either attenuated or. So all this, like I said, I will adopt as written here. I will plead this honorable House to take cognizance of our submissions because the House is our friend. Thank you very much.
Yes.
Thank you, Mr. Chairman and members of this committee, for the opportunity given to us to speak to our submission, which we already made on the 2nd of June, 2020. I want to say that our presentation is simple. Our memorandum, which we submitted, is premised on 3 major areas. Number 1 is we were very, very considerate of the insecurity in the nation. Now, the Quarantine Act that is about to be repealed was made as far back as 1926. That simply tells us that maybe by the time the infectious disease bill becomes an act, before it's reviewed again, some of us may no longer be alive. So we have to be very, very futuristic. Many of the presenters have spoken a lot about the lump of power being given to the DG CDC. And we just want to add that because we do not know who comes tomorrow and how power will be used, we need to be very, very careful and give attention to that area so that somebody don't come on board and hide under an act and unleash terror on our fellow Nigerians. But number 2 area we looked at is trying to balance power between the regulators and those for whom the act is being made. For instance, we observed, let me just give an example of a ship owner, a vessel owner, who brings in vessel into the country and is suspected to be having something to do with infectious disease. The agents of CDC are required to go in, carry out examination, and if in the process, any of them suffers injury, there is a specific fine in monetary terms and in prison terms or both. But the act or the bill is not making provision for the owner of the vessel who may want to challenge such act in a court of competent jurisdiction, because there should be regulations that will guide such investigation. And if the owner of the vessel had complied sufficiently with the provisions of the act, then he has the right to go to court and challenge such fine on him for the injury that may have been suffered by the agents of CDC. The other area we also looked at, the 3rd area, and which is the final, is about the vaccine. Well, we looked through the bill, and we want to confess that there was no clear statement as to say that there will be compulsory vaccination. But just in case we are contemplating on that, we are saying here that IDFAL, which is the Initiative for the Development of Future Accountable Leaders I represent, puts it on record that it is totally opposed to vaccination, compulsory vaccination, and more especially the intention for implant of microchips, because as God-fearing nation, we know that that will violate divine ordinance. My name is Edwin Eze, the Executive Secretary of Initiative for the development of future accountable leaders. Thank you, Mr. Chairman, for the opportunity. Thank you, members.
Thank you. Yes, Medical Laboratory Council of Nigeria.
Good afternoon, sir, the distinguished honorable members and the committee chair. My name is Dr. Akinwale Akinabi. I represent Medical Laboratory Science Council of Nigeria. We have looked at this bill and we propose the following review and amendment. Section 4 talks about notification of prescribed infection disease. The section reads, every person in charge of a laboratory, we see this every person has been ambiguous, that it needs to be defined. We want it to be defined. So in this case, we propose that laboratory is not all commerce affair. We have a professional working in the laboratory. We propose that it should be replaced with every medical laboratory scientist carrying out the test. So then that's our submission on that one. Then section 5, it talks about public health surveillance program. Section 5.4 provides the Director General may send any sample obtained under subsection 2A2 for such test. We still consider this one ambiguous because the section does not tell us where is to be tested the sample obtained. The sample is to be tested in the laboratory, and what type of a laboratory is it should be an approved laboratory or a registered laboratory or medical laboratory accredited for such test, because some laboratory do not have capacity for what we are talking about. So it's better we define the kind of laboratory we are talking about. That's our whole submission on that section 5. Then section 8, the submission of MLSCN. The section here reads, with the approval of minister prescribed by these hospital, medical clinic, clinical laboratory, or health care establishment. We also feel that the word clinical laboratory is actually restricted to a certain section of medical professional. We feel that we should use a general terminology that covers what the intent of this profession is for, which is medical laboratory. Medical laboratory is a general term, and nobody can contest it, and nobody can say that it's not comfortable with the word medical laboratory. So we propose that the clinical laboratory should be deleted and medical laboratory should be substituted. Then 4, on fees, etc. It reads both subsection are contradictory each other. That's our own observation there. And there should be clear directive on where the fund accrued by virtue of the activities carried out under this bill should be paid into, whether it's consolidated fund or the agency fund, but not the both. This thing has to be clearly spelled out. Then number 5, on the repeal, this section 77.2, it is a welcome development at the state that the provisions of this new bill do not affect the existence of any existing written law. What this means is that where an earlier written law has made a clear provision on a subject, any contradictory provision in this new bill does not negate it. Prayers. The council having so submitted above, this honorable committee is enjoined to give the consideration to the objections raised herein and the suggested amendment. Thank you and God bless.
Please, your time starts.
Good afternoon, Chairman and honorable members of the Joint Committee. I am Dr. Matthew Ashikeni, Chief Consultant Public Health Physician, and I am the immediate past Secretary of Epidemiological Society of Nigeria. I stand here representing the President of the Association, who cannot be here because of flight restrictions. That's Professor Ogbonaya Lawrence. The association is made up of epidemiologists. Epidemiologists are the ones that investigate any outbreak in any country. And our members are at the front line of this response. So I stand here to say that we are very happy and support the efforts of the House in trying to bring us up to date. Any law of over 90 years is grossly outdated, and I think it is timely, the efforts of the House. We want to join with all the other submissions, especially the observations by the chairman of the Nigerian Governors Forum, to state clearly that the Director General seems to have been given too much powers. We are looking at a law that will outlive all of us. And we are not looking at individuals, but the system and establish structures that will stand the test of time. So we feel that there should be a board or a committee of experts that will advise the Director General on a continuous basis, so that when, in the event of any emergency, we have experts, epidemiologists, public health specialists, microbiologists, virologists, and experts in these relevant fields, advising him on a statutory basis and not ad hoc, because epidemics can come anytime. Apart from this pandemic, we have our local epidemics that have been ravaging. Lassa fever has been on for a while, and it's almost becoming an epidemic, if not an endemic disease. We also have Ebola, and all these cases can come and go, especially with viruses. So we need to have a system that can respond anytime and very fast. And we believe that this law will enhance that with some amendments. So we want a board that will oversee and advise the activities of one individual, the Director General. Other areas that we feel that we need to say something is that there are existing structures that should be strengthened, and recognizing the fact that NCDC is more like an advisory and regulatory agency. It does not have the personnel, it does not have the presence in 774 local government areas of Nigeria. So there are structures, for instance, disease notification. There is a flow of information from the grassroots, from the community to the health facilities, to the local government, now to the state, and now to the national level. So we should strengthen. It's not very strong now. What we need to do is to strengthen that existing structure so that NCDC will be positioned to respond when it arises. The DSNOs, as we know, disease surveillance officers, are there in the area councils, the local government, and they are there performing their work every day. They are knowledgeable, they have been trained over time by WHO and so many partners, so they know how to respond. They have motorcycles that will take them to the nooks and crannies, and they have community informants that give them information. We take the experience of polio. There are this personnel, this group of people that inform this system that trigger off anytime there is any emergency, and the response is very quick. So let's strengthen the community part of it so that we have community informants that can respond and also feed into the system. We also know that in terms of vaccines, the National Primary Healthcare Development Agency has vast experience over time in issues having to do with vaccine, related with WHO, with UNICEF, and we feel that NCDC should work together with National Primary Healthcare Development Agency on issues of vaccination.
1 more minute.
And we also know that from experience, you cannot force somebody to take a vaccine. Dialogue is always the best option, so that it is a sustained effort and response.
However, when there is difficulty, we use the legal system or we use the existing due process to engage with that person and get the vaccinated. So I want to conclude that this law is apt. If we are trying to update it, it's very, very important. But let us work with existing structures, at the same time reduce the power. Too much power in one individual will not help us. We thank you for the opportunity, and we'll continue to work with the House to make sure that our people get good laws that will improve on what we do on a daily basis. Thank you very much for this opportunity, sir.
Good afternoon, Honorable Chairman, honorable members, invited guests. My name is Bello Gondu. I represent the Executive Secretary, CEO of Nigerian Shippers Council. Mr. Chairman, the Executive Secretary of the Nigerian Shippers Council sends his apology for not being able to attend in person due to these circumstances. He wished he would have been there in person to lead with the legislature. Ours is a few observations we made in the memoranda which relates to section 1 on the powers. I don't need to overflog it because it has been overflogged. What we are recommending that the standard practice is for the institution to be vested with responsibility of implementation of legislation, not the office or an individual. Then section 27.1, we felt authorized health officers should be able to make a declaration. It needs not be the Director General that must make a declaration whether a ship is infected or not when it arrives into Nigeria. Any authorized health officer can do so. And the most important one is section 28.1. The law empowers, the bill tries to empower the Director General of NCDC that it says, let me quote, the owner, master, and the surgeon, if there is one on board, or the agent of any vessel arriving in Nigeria, shall provide such particulars as may be required by the Director General or Port Health Officer in such form or manner as the Director General may require. Shipping is an international business, Mr. Chairman, and it is governed by international conventions, a lot of them. Either if it is the aviation, we have the ICAO, which has made regulations, a lot of them, guarding transportation by air. So there are forms, like under the Fall Convention, which under the Fall Convention, that's Facilitation of Trade, International Trade Convention, which the Nigerian Shippers Council is trying to see its domestication. It has provided certain procedures or requirements which every vessel is supposed to, or the owner is supposed to, or the agent is supposed to tender to authorities upon arriving in Nigeria, which is sufficient. It will give all the information. So it needs not, I think the bill should reflect such international arrangement, because we are dealing with multinational corporations who are also signatory to such legislation. Then going further, we have made, proposed some addition of new subsections which we're trying to incorporate from an international convention, which I mentioned, the Facilitation of Trade Convention. And then lastly, what I say, we raised some observations
that there is no provision allowing the center to apply for the funds accruing to it to defray costs and expenditures incurred. We have also seen that too much reference been made to the Director General, Port Health Officer or Health Officer, whereas the phrase authorized officer, person or officer or reference to the center being a juristic person is preferred and can be adopted as a substitute where necessary, which is more fluid. And there are other persons whom the proposed legislation empowers to carry out certain acts, which by the use of authorized person will cover, because there are certain aspects of the implementation or enforcement that cannot be done by NCDC staff, but some other legislation by extension will empower them to enforce the provisions of this bill. And then when it comes to the jurisdiction of the court, Honorable Chairman, the Constitution of the Federal Republic of Nigeria is specific, Section 251, empowers the Federal High Court to the exclusion of every other court to have original jurisdiction in matters that relates to decisions, pronouncements, and actions of the federal government or any of its agencies. The NCDC is an agency of the federal government, so it cannot escape that
We'll look at your submission.
Constitutional provision.
Thank you, sir.
Thank you very much.
Yes. Environmental Health Officers Association, last but not least, so that we can adjourn. Please come now.
The Honorable Chairman and members of the House of National Assembly, I want to thank you on behalf of the Environmental Health Officers Association of Nigeria for giving us this opportunity to make this presentation. I'm also thanking you, appreciating and congratulating you for this very important bill. We identify with you on this journey and we want to pray that there will be success at the end of the day. However, we have this observation in the bill. Actually, this is born out of the fact that we cannot completely extricate prevention when we talk in terms of control of diseases. And so, we want to establish the place of prevention as of the role of environmental health officers. And this particularly is talking about the part 1 of the bill, number 2, which is talking about the appointment of a health officer. Though it has been so much said, but we want to emphasize that health officer still exists in our previous legislations, and the definition need not be made open that it becomes all comers, because if he or she that is not trained, certified in the prevention of diseases is allowed to go into it, it might cause further damage even to himself or herself. So I make reference here to the Public Health Laws of 1963, Cap 165, Cap 1003, and also Public Health Laws of Western Nigeria and other states, including the recent ones of some states, including Lagos State and the rest of the states, in that the health officer is including medical officer, environmental health officers, public health superintendents, health inspector. This needs to be clearly spelled out, and that will handle the unnecessary suspicion of members of the public as to what exactly the bill is talking about. Because if the round peg is put in a round hole, definitely the essence of the bill will be achieved. If it has to be a professional that goes after inspection, detection, and abatement of nuisances, definitely control of prevention and control of diseases will be achieved. Bear in mind that prevention, environmental sanitation remains the veritable weapon for prevention of diseases globally. Thank you very much, Chairman.
Ladies and gentlemen, I want to use this opportunity to thank all the honorable members that are here for your endurance and patience to be here with us until the end of today's occasion. I also want to thank the various organizations that made it to this occasion today. In all this, it just shows how committed we are to better this country. And I assure you, the three committees will look closely into your presentations and will come up with a document that will be representative of our collective bargain so that we can move this country forward. The fact is that a lot is needed and a lot needs to be done. So we can only achieve this collectively. It is my great pleasure to now invite one of us to move a motion for adjournment of this sitting tomorrow 10 o'clock in the morning. Honorable Ishak.
Thank you very much, Mr. Chairman. The Deputy Chairman, distinguished honorable members here present, all our invited guests. In the absence of any further deliberations today, I, Isiaka Okunle Ibrahim, I move that the meeting be adjourned to tomorrow 10 a.m. I so move, Mr. Speaker. I'm sorry, Mr. Chairman. Thank you.
Secondas.
Honorable Chairman, colleagues, invited guests, I, Boniface Reba, representing Equereme of Rare Constituency, to hereby second the motion for adjournment for this meeting tomorrow. I so second.
Honorable members, the meeting is hereby adjourned till tomorrow morning, 10 a.m. Thank you. MC.
My name is Boniface Emerengwa. I represent the good people of Equereme Africa constituency in Rivers State. I am a member of this committee.
Chairman, Deputy Chairman, honorable colleagues,